Hello, gorgeous girl. Happiest German Shepherd in the world. Your call made me think that she's maybe not so happy at the moment.
No, she definitely isn't the happiest dog at the moment. She's been having a lot of pain in her rear legs and a lot of trouble actually running and walking and standing.
Well, before I have a little feel, what I might ask you to do is if you can just walk her up and down the pathway here and I'll have a little look and see what I can see.
Okay.
Yeah,
You want me to walk
okay?
or run her? Or
Well, let's start with walking, and then I might get you to do a bit of Usain Bolt. We'll see. We'll see.
Okay, I'll do my best.
Okay, have a little walk and we'll see.
Come on, Hannah, come. Hannah, come.
I ask Lee to trot out Hannah just so I can see her moving, and straight away I can see there's a problem. Certainly not normal. Hannah is actually walking very strangely on her ankles and actually almost falling down on them, leaning back and just pushing right down to the floor. It's a very odd gait and certainly something that I need to get to grips with. Let me just have a feel of these ankles then. Good girl, you're being such a good girl. Hey.
That hurts. You can tell that when you went to that area of the rear leg, she turned with her ears back and she feels pain.
After examining Hannah, I can see that there's lots of little things, but I don't find that they add up to the major problem, which is that this dog is walking very strangely on both back legs. There's a spectrum of possibilities here, though, from something quite mild. It could be just a ligament strain. It could be a little bit of early arthritis, right up to really quite severe things, with the worst case possibility being some type of cancer. When we see dogs like this that are lame suddenly, cancer is a possibility. The worst case scenario is something called osteosarcoma. It's an exceptionally aggressive tumour that grows very, very quickly. And unfortunately, in a lot of cases, the dog can die very quickly. I know how much you love this dog, I do. So what we need to do is just to look at this a little bit deeper, and the way we can do that is with X-ray.
Right.
So I am going to take you, devoted owner and beautiful dog, back to the practice, and we're going to look into this further with X-rays.
Okay, thanks, Scott. Thank you.
No
Thanks.
worries.
All right, little man, let's get you out. Hello.
Cutie.
Oh, hello.
He seems so sweet.
Who are you?
Back at the Richmond clinic, practice manager Maz has arrived with a lost waif for head vet nurse Emma to check over.
So I got a phone call from a woman who lives just around the corner here saying that this cat had been coming into her garden over the last sort of few days to a week, didn't seem to be going home anywhere, seemed to be sleeping there at night, and she got a little bit concerned that he was lost. So I went down and picked him up. You like that?
Someone's got to be missing him because he's just too cute not to be missed. Right, buddy, let's scan you for a chip.
Hopefully you've got one. So the first thing that we do is check for a microchip. On the microchip would be the cat's name, the owner's name, a contact telephone number and their address, so we get an idea of where around here they actually live.
Oh, not in the usual spots. Doesn't look like you have a chip, buddy.
Oh.
Unfortunately, in this little guy's case, there is nothing there. So let's just see if we can find out where you're from. It's literally like looking for a needle in a haystack. Cats travel miles to find shelter, food, water, so need to figure out where we're going to go from here.
With no microchip found, the difficult search for the stray cat's family will now begin.
So what are we going to call you in the meantime?
Colin. Colin cat.
Colin the cat. I was going to say Barry.
Barry.
Whenever a stray comes in, we always want to give them a name. Maz and I tossed up a couple of names. Edward? Edmund?
Eduardo.
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 Are you going to be an Eduardo? Oh, yeah.
I think we found your name.
We've stuck with Ed the cat.
See you later.
Cutie. He put his little paw out like a little gentleman. He's come from somewhere, and we just hope that we can find out where.
See you later. See you later.
While Ed's adjusting to his new surroundings.
Hey, Ems.
Hi.
Hey, I've got the gorgeous Hannah with me.
Hi, Hannah.
Hey.
Hello.
Hi.
Emma is needed to help Scott find out just what's wrong with Hannah.
Well, she's walking very weirdly.
Okay.
Yeah. We just had a little walk in the park, actually, with Lee, and she's walking really quite strangely, so we're going to do a few x-rays.
Sounds
All right.
good.
Do you want to hold her for me and I'll
Hannah
get an
did.
IV in? Yeah, good girl.
Oh, such a good girlie.
You know what is quite weird? Looking at the front legs, her wrists are doing the same thing that her ankles are doing in the park. And that they're actually bending quite significantly downward. So I'm a little worried that her ligaments across the board are just a bit weak. There's no strength or support to any of her joints.
Owner Lee is upstairs, anxiously waiting for news. Since the age of 5, she has always had a German Shepherd in her life.
Maybe they're not human, that's true, but they're as important to me as humans. That's just how I think about them, so they're just integral part of my life. I couldn't live without having my German Shepherds. I don't think I'd be a very happy person.
Okay, Lee, so your little lady is absolutely fine. And we've just put a little IV catheter in and then we've just given her sedation just to take the edge off and she's nice and calm. So do you want to join me downstairs?
Yes.
You can comfort her while we x-ray.
Great,
Yep?
thank you.
Come on down. Normally, we wouldn't ask an owner to join us in the x-ray room, but I knew that I couldn't fight her off and she really wanted to be there. So I thought, you know what, it's going to comfort little Hannah, so why not? There she is, so grab a little pew there. We just put this on so it keeps her nice and sleepy. So there's your girl. Okay, she's absolutely fine. Nathan, doing well?
Yeah, really good.
Good job.
She's a strong dog. Mama's here, sweetheart.
Good. All right, so whilst you're giving her lots of love and cuddles, we're going to crack on with the x-rays, okay? So, it's understandably worrying times for Hannah and her owner Lee. The worst case scenario could be cancer development in some joint, which is very common in German Shepherds of a certain age, all the way down to just a mild amount of arthritic change. So at the moment, we don't know what the problem is, and we certainly do have a very worried owner in Lee. Out we go, everyone. Okay. Right, x-ray.
It's never nice to see your dog sedated because, you know, their tongue is hanging out and you don't really know, because you're not a doctor, whether she's breathing or not or how she's doing. It's always a risk anytime a dog is sedated. Okay, honey, they're almost done.
The x-rays are now completed. Lee is about to find out what's wrong with her much-loved Hannah.
The good news is that it's not cancer.
That's great news.
Yes.
So that is, makes my day.
Absolutely,
Year.
absolutely. Yes, and so look, we can deal with everything else because the worst case scenario is now off the table, so phew. But the little changes that are present,
Yeah.
I don't think quite add up as to why she's walking so weirdly. I mean, she's walking weird, isn't she? I mean, I think that's the official diagnosis. Yeah, I'm just going to give her a reversal and should mean she wakes up nice and sharpish.
Lee is relieved that cancer has been ruled out, but Hannah's medical mystery is far from solved.
I'm not comfortable with that situation. I like to know exactly what's going on, and in this instance, unfortunately, I don't.
Okay, Mama's here, honey.
So Hannah will now be referred to specialist orthopedic surgeon Michael Hamilton.
Well, Lee, I'll leave you to have good
Yeah.
snuggles with your little lady.
Okay, good.
And I will put a call through to Michael and see if I can organise that appointment.
That sounds great. Thanks, Scott.
All right,
Thank
no
you very
worries.
much.
Oh,
Thanks.
beautiful.
Scott's on his way to St Margaret's after a distressed call from one of his favourite clients.
I've just had a phone call from Peggy and she sounds really upset. I don't know what's going on, but something's definitely happened. She doesn't even want to talk about it over the phone, so I'm just going to drive straight to her house now, check up on Archie and just see exactly what's going on.
We first met Archie and Peggy when Scott was helping the 74-year-old cope with her new rescue dog. Archie came with a lot of baggage. He wasn't house-trained. And he had a nasty habit of biting people who tried to get him out of the car.
Come on then.
Good boy.
But on top of all that,
X-rays?
Scott had to break the news that the 2-year-old Bulldog was suffering from a shocking premature case of arthritis.
There's no drug that exists that's going to fix that.
A cutting-edge plasma injection helped get Archie back on track. But now it appears something else has gone wrong.
Hello, Scott.
You all right? You
Yeah.
sounded pretty distressed on the phone. What's been going on?
Oh, Oh, lots. He bit me.
What? Where did he bite you? Show me. Oh, God, Peggy.
Well, he was having a sort of choking fit, and I got worried, and this was 1 o'clock in the morning. I got worried, and I just called the emergency vet.
Yeah.
A vet nurse arrived and decided to take Archie back to the clinic to make sure nothing was stuck in the bulldog's throat. But once again, Archie's car issues made him lash out.
He snapped at her. I grabbed his head here and pulled him towards my right hand. He bit it. So really, I was trying to save her and didn't quite do it properly.
Dogs get black banned as being aggressive as soon as they bite, and I'm someone who absolutely backs that up. In the case of Peggy, this was one situation where a stressed dog bit someone in a point of madness. I don't think that he meant to bite Peggy, but he did. I just absolutely love him, and I absolutely love you. You're such a force of nature, and so is he, and it's just, it's heartbreaking to see that this hasn't worked out.
I can't say... I don't know what to say. I love him to bits. I love you. I love you to bits, darling. Oh, thank you. I got a kiss. I knew in my heart of hearts that I couldn't really keep him, but there is somebody who's the right owner for him in the right environment, and if you can find that for me, I will be eternally grateful.
I couldn't admire Peggy more, but she knows what needs to be done and she's gonna do it. And it doesn't matter if it hurts her in the process.
I'm going to miss you. I know. Are you going to miss me?
I'm gonna miss him too. Grumpy old sod. Okay, take care. Come on, mate, let's go. Good boy. Come on, mate. Good boy. Good boy. Sit. Okay, let's go.
I didn't want him to look back. I wanted him to just go out, and he did it. You know, he's not going to miss me as much as I'll miss him.
Archie will now live at the St Margaret's Clinic as Scott takes on the responsibility of finding the flawed bulldog a new home.
I know he will, because I know he cares about him almost as much as I do.
Come on. That's a good lad.
Hello. I'm just doing a bit of a ring round. We've got a lovely black and white cat that's been brought into us, just in case any of your clients might be missing one.
While Archie's now on the market for a new residence, Emma's working the phones to try to track down the owners of a stray cat that was found by a local resident.
I've nicknamed him Ed. He's really gorgeous. He's got a big white chest and he's got a really cute black splodge on the end of his nose.
Sadly, Ed has no microchip.
I called some of the local vet practices. No one is missing a black and white cat. No one at that one. On to the next one. Normally within 24 hours, we would at least expect a phone call from someone to say, have you got my cat? If that doesn't happen, it's a 2-week waiting period before we have to make a proper decision on where Ed goes and sort of his future, really. Lots of cuddles for you today. Oh, Maz, I tell you, I think I'm a little bit in love.
Well, don't find his owners. I'm gonna need to go somewhere.
Oh, don't tempt me. He's very friendly, just wants to say hi to everyone.
Next day, Archie is making his presence felt at his temporary home.
Oh.
That wasn't as nice as it was supposed to be. I do apologise. Come on.
Finding the right forever home for the exuberant bulldog is high on Scott's priority list. But today, he's making the 3-hour drive to Somerset for a long overdue catch-up at a place called Secret World.
There are times in life where you meet people truly special, people that you know make a real difference. Pauline Kidner is one of those people. She was one of the original wildlife warriors here in the UK and set up an amazing rescue centre for sick and injured wildlife about 20 years ago. I've known her for years. She's a fantastic lady, and I've always promised that I'd go out and see the great work that she's doing. And I'm excited to say that today is that day. Hello!
Hey, how are you?
Mwah. Great to see you. So amazing to finally see Secret World. It's gorgeous.
Well, it's not just pretty. We're very, very busy.
Okay, you're putting me to work already?
You're coming here to work.
Gee whiz, you drive a hard bargain. Let's get stuck in.
Over to see Michelle, our vet nurse. Is that okay?
Great, yeah, absolutely.
Because there's lots of stuff coming in.
Outside, Harrison and Philip are just pulling up with an injured tawny owl.
Still awake.
Still a bit chirpy.
Yeah.
The good-hearted lads were attending a call-out to fix some power lines when they nearly ran over the bird lying motionless on the road.
He was still alive. We quite like our animals and things like that, so we thought we'd bring it in.
What was his story? How was he found?
We think he's been hit by a car. We found him in the middle of a road. He's
Okay.
quite dazed at the moment.
Well, I'll take him through and have a good check of him.
All right.
And then obviously see if there's anything that, you know, what we can do and what injuries he has.
All right, lovely.
Thank you.
We should get a little bit of a bonus for that, I think, for rescuing the wildlife as well. So we've done our bit.
So let's hope that it's all good news for this guy.
Yeah, absolutely.
Oh,
Brilliant.
oh, it's absolutely stunning. It definitely does look like a road trauma, doesn't it?
Yeah, absolutely. And you can see his left eye here is closed. So what we're going to do is just have a quick look in and just make sure there's no prolapse, no hemorrhage that obviously requires immediate attention, which there's not.
It's just like a black eye, really, isn't
Absolutely.
it? After being hit in the face by a car.
And then we just extend the wings.
It's always great at places like this to find the woman to deal with. And veterinary nurses are pretty strong characters, and Michelle is absolutely one of them. And she pretty much tells us vets what to do.
So if you could just stand a bit more towards me and pop him down, just because I'm a little bit vertically challenged.
Yes, yeah, I'm used to working with the shorter of our community.
Oh, there we go.
Michelle is now using a crop needle to get important fluids deep into the owl's stomach.
Within wildlife, euthanasia is never off the cards. There's many times that we've orphan reared, we take animals home, we put our heart and soul into it, and unfortunately, for whatever reason, if they can't be released, you have your heart broken, but you just learn to cope with it better.
Good bird, well done.
The tawny owl is now being put into an incubator to recover.
So, Michelle, do you tend to give your patients names?
Sometimes, usually it's to do with their character.
I think this guy's pretty eccentric because he's kind of a bit piratey.
He is.
So
He
maybe
is.
pirate?
Yeah, we can do that.
All right then, pirate. I noticed no one else really talks to the birds.
No, we try and keep the vocalisation around them to a minimum. It is something that they wouldn't have in the wild, so we try and mimic that as much as possible. So they're not seeing that humans are their friends. It is something that they need to be scared of us to get the best in the wild.
It's not a problem for me at all because birds never want to talk to me anyway.
Well, standing here, I could see that.
Oh, delightful. Normally, as a vet, you're used to giving a huge amount of heart and love and empathy for your patients. In the case of wildlife, you have to fight that instinct. So at every moment dealing with Pirate, I just want to give him a cuddle and talk to him, but I can't. Did you hear that, Pirate? Sorry.
I think currently Pirate probably has a 50-50 chance, so the first 24 hours is going to be a really crucial time for him.
That's my girl. Come on.
Meanwhile, in Buckinghamshire, orthopaedic specialist surgeon Michael Hamilton has fast-tracked an appointment for Lee.
And just slowly across in front of us.
Under his expert eye, 7-year-old Hannah is being put through her strange-looking paces.
Hannah? Hannah?
Lee wants to know why her German Shepherd can't run or even walk properly.
Not knowing is always a little bit nerve-wracking, what the real issue could be, whether it's something that he feels he can address or correct, or whether this is something we're just going to be dealing with Hannah.
Okay, I'm back again.
Yeah, a little trepidation there, but of course we came out here because we're looking for the solution and trying to really give Hannah the relief she needs so that she can get back to normal.
But Michael's diagnosis is not what Lee was expecting.
From my point of view, the most obvious thing is her wrist joints.
On the front?
Yeah.
Okay.
Both of her wrist joints are actually kind of collapsing. So dogs, as they walk,
yes,
they've got wrist joints like we do, but they walk up on their toes like this.
Yes.
And the angulation between their wrist and their foot is usually maybe up to about 30 degrees like this. Now, when she walks, this is almost going down to 90 degrees.
That,
She's almost walking on her hands like this.
Oh my.
It's called hyperextension, which basically means that the wrist joint just extends more than it should do.
Right.
And the implication of that is as she walks, she can't physically kind of push because the whole wrist joint just collapses. Because of that, I think she's thrown her weight back onto the back legs,
which is why she looks walking odd.
She just looks a bit peculiar.
Yeah, she looks arthritic.
But the good news is we can usually do something about it.
Great.
So,
okay.
yeah,
Great.
good.
Thanks.
So let's go back to the clinic and we'll have a good old feel.
Great.
So, okay.
Well, my hopes is that we don't have to do anything invasive.
Okay, go on then, Hannah.
I really would like to try to avoid doing any kind of surgery on Hannah. It's always a risk and the results aren't always clear.
What we need to do is put the wrist at a more appropriate angle and stop it doing this.
Right.
And what we do is we fuse the wrist joint with a plate and screws. On both sides. But any pain that she does have will go away, but the most important thing is she'll be able to push off because the thing won't collapse because it's going to be fused.
And what happens if we don't do
Yeah, if we leave things, she'll probably just get progressively more and more hyperextended to the point that eventually she'll be walking on the backs of her wrists, and then you start to get wounds and sores and all the rest of it. Yeah. So I mean, it's
not an option, but I just wanted to ask what would happen.
I mean, the prognosis is good.
Okay,
the prognosis
great.
is really
Great.
good. Yeah.
Good.
It's quite a big procedure, particularly if we're going to do it on both sides at the same time. The potential risks are that the joint just doesn't fuse, because it's, not to make it sound too dramatic, but it's a bit of a race against time that the joint fuses together before the implants fall out.
Okay, sweetheart.
The decision is now up to Lee, but she's clearly torn about whether to put Hannah through major surgery.
And it has been really exhausting, going through this, because it's like trying to find your way out of a maze, of sorts, to what's the right thing.
Let's have a little feel here.
The puzzle pieces are now fitting together, but that last big piece is going to be the surgery.
She's got a bit less weight on this front right leg.
I see that. I'm really concerned because, as her mother, I have to nurse her back to health. I'm ready and I'll get her prepared as well. She's like her mommy. She's tough. She's tough.
So yeah, the mini block really is for animals that are hands-off.
Scott is paying a visit to Secret World in Somerset. Pauline is the founder of the now famous Wildlife Rescue Centre, and she's decided to allow Scott to meet some of their most beautiful orphans.
Pauline opens the stable door and wow. In front of me is a vision of beauty.
I think fawns are probably one of the hardest orphans to rear, and they just are an animal that literally can die from stress.
They're just exceptionally beautiful animals, and I think that's actually one of their downfalls, is that people see them alone and automatically want to pick them up and give them a cuddle. But in fact, Mum has probably left them there and knows exactly where they are and knows they're safe. But by cuddling them, Mum's almost certainly not going to come back. And that means they find themselves in rescue centres like this.
And that
Whoa.
one.
You're enthusiastic.
That's the two you've got there.
Gee whiz. Whoa.
Right.
Okay, wow, you're more hungry than my baby son.
Scott will be bottle feeding the two fellow deer, Angus and Devon, but there are strict rules.
From the first moment that I saw the fawns, I was immediately instructed that I could not talk to them. I could not really gain eye contact with them. I just had to feed them and that's it.
Come on.
Hello, wow, you sculled that, didn't you?
Yeah,
Wow.
they're very fast feeders.
Gee. They are beautiful.
That's no, you shouldn't be letting them do that.
You can't kiss me. That is far too forward, I'm afraid. Pauline gives me the evils, and straight away I think, oh God, I've done wrong here. But you know what? The fawn made the first move and was pretty nice. Hey, I'll buy you one drink. Just
we
one
all know
drink.
we love him, don't we? Eh?
I totally respect your restraint because I can just feel from this little animal that it wants me to mother it.
Yes.
It really does.
Yes, absolutely. And that's what we don't want them to know, that they can do that.
The great thing about looking after these fawns in this way is that they actually eventually are going to be released into the wild. What a fantastic vision that must be. So I've definitely signed up for being involved with their release when that does finally happen.
Okay, you know that we weren't allowing you to cuddle anything because it's not what we do.
I know very well, yes.
Well, with this one, you can cuddle her all you like.
Yes, finally a bit of animal cuddle. Fantastic.
Isn't she so
I've been trying to obey orders. I've tried not to cuddle anything. I've tried not to talk to anything. So Pauline goes, you know what? I've been good, and she's going to give me a little surprise just as a thank you. Oh, wow. She is so divine. So, sorry, what was her name?
She's Polly.
So Pauline introduces me to Polly, the red deer. She's absolutely beautiful. She's about 20 years old, and she's actually a pet.
Do you love me, or do you just love bread? Do you love me, or do you just love bread? You're a silly.
She's an animal that has been used to humans all her life, and as much as they tried to put her back with red deer, she wasn't having a bar of it.
Come and have a look and see who her friend is. I think you might recognise her. If I can... There she is.
Oh, you've got an emu. That is the most extraordinary pairing I think I've ever seen. A large Australian bird and a massive red deer are mates. All right, well, that's something I've never seen before. Who expects when you're walking into a deer's enclosure that you're going to see an emu? And what was even more amazing was when they were side by side, it looked a little bit like the Australian coat of arms, except for whatever reason, the red kangaroo had morphed into a red deer. But hey, when in England. G'day, mate. Been in England too long.
Lost his accent.
Lost his accent. You've changed. You've changed. Okay, mate, let's have a look at you. Wow, you're looking so much better. That head tilt's resolved, isn't it?
It's time for Scott to head home, but he wants to have one last look at Pirate, the little owl that was run over by a car.
A massive relief to see little Pirate improve dramatically, and he's actually looking out of that sore left eye, so might have to consider a name change. This guy, if all goes well, he'll be flying around in the skies of Britain once more. So yeah, it's fantastic. I love where I work, but being here and working with these dedicated people, I totally understand how they become so passionate about wildlife. They're not earning loads of money, they're doing it because they love the job. Pauline, thank you so much for having me. It's been such a great time here at Secret World.
Thank you for all you've done. It's been great to see you. And I just thought you'd like to see the new member of staff here.
And no one's going to tell me I can't give you kisses. No, they're not. No, they're not.
If you only knew how many things this man has kissed, and you're still doing it.
Exactly. Well, and you're yet another one. Mwah. See you.
Take
Great
care.
to see you.
Hope to see you again.
Bye.
Bye.
Make a poster, so we take some photos of you.
Back in Richmond, Emma's arrived at the clinic with a new plan of action.
Come in this morning, unfortunately no messages, no emails from anyone wanting to claim little Ed. Hey. He's got no microchip, we have no idea which part of town he's come from, where he's come from. Time to make a poster.
But after only 24 hours, Emma is growing increasingly attached to her little ward.
Someone's got to be missing you. I know I would, right? I know I would. It's not uncommon for us to get stray animals that come in through the door, but something about him, I can't quite put my finger on it. He's pulling on the heartstrings a little bit, is Mr. Ed. All right, let's print this off and put him up outside. It would be such a shame to have to put Ed into a rehoming centre. He's so friendly and just loves the attention from a human. Hopefully someone walks past him and will recognise his little handsome face. Fingers crossed.
Daddy's gonna pass it now. Go ahead.
4 weeks later, after a lot of soul-searching, Lee and her husband, Chiro, have made a surprise decision about Hannah's surgery.
I had several kind of sleepless nights where I was trying to process so much information about Hannah. And, part of you wants to go right to a solution because I'm kind of a fix-it kind of girl. And in a way, I had to consider, is there a smarter way to do this that isn't as extreme as the step of fusing her paws? I had to wait for a sign, and the sign really was Scott calling and saying, wait a minute, I think we got a solution here that can give her the kind of help she needs.
Come on, Hen. Gonna go see Dr. Scott?
Yes, hello, gorgeous. Look, I've got your shoes.
Come on.
Yes, look at this. What's this thing? Hey, what's that? I think these supports could be the answer to Lee's prayers. She's not that keen on surgery, and that's fair enough. What are we doing?
Oh my goodness, that's so pretty. Wow.
It's been tough actually waiting for the braces because when I watch her walk in the park, I can see how far down she is on her pastern, and that's upsetting. So now to see her lifted up like this, it's great.
Good girl, well done.
Very good, honey.
Certainly when I placed the supports onto Hannah's forelimbs, she wasn't the graceful shepherd that you would expect. She kind of looked like maybe she'd had a few too many.
Okay.
What's that feel like? Is that weird?
Yeah, I know.
But you know what? She will get used to it. And what it will do is just rebalance her whole body. Hey?
Very good.
All the while looking very stylish.
Very, very stylish. Very stylish.
Yeah.
Yes.
I think that these supports are the right thing to do, but eventually I believe that the perfect world would be to have them supported permanently. And the only way to do that is with surgery. But you know what? You have to respect the owners and you have to respect their love and their understanding of their own pet. You ready to go out and hit the street? Show everyone your new shoes?
Yes.
Hey, you ready to go? All right, well, good luck.
I feel like we made the right decision for our baby, yeah.
Come on, Hen. That's a girl. Go slow.
While Hannah is adjusting to her new shoes,
Fallen in love with this dog a little bit, haven't you?
How could you not? Look at this guy. Look at this guy.
there has also been a good result for Archie. A foster home has finally been found.
Always a big good boy.
In 2 weeks, the star boarder will be leaving, and these playtimes will be over.
Archie has been really the life and soul of the practice for the last few weeks. He's such a character. He's got such a great nature.
I don't know whether that's really sweet or whether that's
really
disgusting.
Don't care, do we, mate? Don't care. It's been a bromance, and I'm really going to miss him. He's a legend.
Yeah, I know. That's good, isn't it?
There he is, the man himself.
Morning.
Hi
How
again.
are you, Pauline? Good
All right,
to see you.
this is Josie.
Hi, Josie. How are you? So you're the one I have to blame for this ridiculously early morning start?
Well, if it was up to me, it wouldn't be this early.
Normally I'm used to getting up this time of the morning with 3 screaming kids, so actually this is quite calm.
It's 5 in the morning, and Scott is back at Secret World. It's been 6 weeks since he met Angus and Devon, and now they are ready for release.
Okay.
Scott will be going on the journey to release the fawns with their primary carer, Josie. It's her voice only that the fawns have come to recognise and trust.
Hello.
And they will need her reassurance during this stressful transition.
No, I'm a little bit teary. I don't really want them to leave, but they kind of have to. And I know it's what's best for them, you know, and I don't want to hold them back because of my feelings for them. It's all right. Hello. It's okay.
Little Devon was found huddled next to her dead mother after she'd been attacked by dogs. Angus was found in a ditch, alone and starving.
It's quite tense to catch young deer like that. They're still quite nervous.
Come on then, you.
And they've got tiny little legs that can break easily.
Come on then, gorgeous. Look, it's nice and warm and cosy. Devon will follow me. I just know she will. Good girl.
Wow, she was very good about that, wasn't she?
Good girl, Devon.
Now it's your brother to go.
He's a good boy, Angus.
You're right.
Come on.
Yeah.
Angus is quite flighty. He's a lot jumpier than Devon. Devon? If you could grab his back.
Yeah.
Good boy. Good boy. So I'm a bit worried about how he's going to sort of get in the crate. There we go. Good boy.
Well done.
Angus tried to have a bit of a pop at the end. With Scott's quick handiwork with the door, we managed to get him in nice and comfortable. And now we're just really excited to get going. Good boy, Angus.
1, 2, 3.
It's going to be a long 4-hour journey from Somerset to the special release site in Surrey. Pauline is just hoping the fawns will stay calm and safe during the journey.
So you're going to drive the truck,
Yep.
I'm going to drive mine, and we'll reconvene on the road to check them over.
Yeah.
I'm sure he knows he's got some precious cargo there and he's going to be careful, but no doubt Josie will be keeping her eye on him.
After the babies. I will. I'll see you later on.
It's always hard when we let animals go because we know that it's not the best of worlds out there, but we've done as much as we can and, hope that they'll be safe now.
Hold on, Angus.
That's a good girl. What a good girl.
After a long 4-hour journey, Scott and Josie are about to arrive at the release site in Surrey with Devon and Angus.
It's a massive relief to have gotten here and that both the deer are safe and are moving on to this very exciting next stage in their life.
This lush private property is the fawns' new home, where they will be introduced to a herd of fellow deer.
Hello, gorgeous boy. Hello. There's a good boy.
Fantastic. How are you feeling?
Brilliant. Yeah, it's really, really good.
It's amazing, isn't it, to see him like that running around already and seems comfortable and...
Yeah, he's really enjoying it, look.
Look at you being all emotional.
I know.
It's like a proud mum.
He's loving it.
He's actually looking at that other deer already.
That's got to be a completely new feeling for him.
Finally back with his own kind.
He'll soon scoff their food.
Just like raiding another kid's lunchbox, do you reckon?
Well, at least you know you'll never starve.
Initially, the fawns will stay in a large pen with food and water. Over time, they will slowly graduate to independence.
Right.
Okay, the last one of your babies.
Hello, darling. You're doing a wee. Lovely.
Very nice.
Come on then, Sita.
Beautiful.
Hello,
See your brother.
gorgeous. Hello, gorgeous. There's a good girl. Hey? It's going to be really hard to say goodbye to them and leave them here. It's what's best for them. And I know that, but it is really difficult. Are you a good girl? And it's a really emotional time for me, as well as it is for them, I'm sure.
Josie is not the only one struggling with the separation. Unlike Angus, Devon is still looking for reassurance.
Please don't beat me up.
Before she takes her first steps towards a new life.
I'm really happy with where they are and how they're going to be, and that's just what I've got to remember when I want to take them home with me. Where is he, Devon? There he is. Just overjoyed, absolutely overjoyed. And it's just lovely to know that they're going to be happy here. I'm also a little bit nervous for what world awaits them, but they've had the best start. We can't do any more, so I just wish them the best of luck.
Well done. That's fantastic.
All right, little buddy. Here we are.
As for the practice's stray cat, Ed, nobody has come forward to claim him. But Emma has a plan.
What do you reckon about staying? I'm gonna... Oh, is that a yes? Is that a yes? Hello. I've always been more of a dog girl growing up, but something about this cat has stolen my heart. See, I reckon any cat that lies like this has got to be 50% dog. Because this isn't normal. Cats don't do this.
Although Emma and Ed have made up their minds, there is still one person who needs convincing. Emma's partner, Steve.
Hello.
Hi.
Hey. Who's this little guy?
He's cute, isn't he?
Oh, you know, I did say I was a dog person.
I know.
But I
look
could
at
be
the
swayed.
face. Hello, buddy. How can you not fall in love with him? Please, can I have a cat? Please, can we have a cat?
He can stay.
Can he stay?
Yeah.
Yay! You can stay! I am over the moon. I'm so happy. Hello, buddy.
He's adorable, and he won me over in seconds. He was purring away, and it had those dog-like features, which, you know, I kind of call him a dog cat. I couldn't be happier. Welcome to the family, Ed.
Yay. Welcome to the family.
It's the first time you've been at a beach, I would have thought. It's nice that you worked on your bikini body at least. Yeah, well done.
And the day has finally arrived. Archie's new foster home is in a seaside town close to Brighton, and Scott is taking him on one last walk.
Very important that you behave and let them see how gorgeous you are, yeah? I've come to the beach today to just spend a little bit more time with Archie and to say goodbye, really. So it's a pretty sad day. It's your last chance, my friend, okay? So take it with both big grubby paws, yeah? Couple of bulldogs, Archie. I think we're here. Hello.
Hi, nice to meet you.
Nice to meet you as well.
Lou from British Bulldog Rescue is going to be Archie's new foster mum.
Now look, this is Archie. He loves the car.
Doesn't like getting out.
That's it. But just that moment in time. The rest of the time, he's an absolute sweetheart.
Okay.
So, here's the chap. Say hi.
Hi, gorgeous.
You big handsome brute.
I just thought he was adorable. As soon as I saw him through the window, I was like, oh, bless him. He is absolutely gorgeous.
Come on then, mate. Out you come. Good boy. There we go. And then he comes out. Good boy. There you go. Getting Archie out of the car was always a little nerve-wracking, but thankfully, he was the perfect gentleman. He didn't put Lou off at all. She seems completely unfazed by it. Already, I'm feeling this is the place for Archie. Okay, so this is his new digs then.
Yeah, this is where Archie's going to be living.
Boy.
This is his little safe place.
Bright pink water bowl. Lucky he's in touch with his feminine side, hey?
Definitely. This is the garden. This is
Archie's new home is perfect. So I couldn't be happier. I think he's a very, very lucky lad.
He's absolutely gorgeous.
Oh, thank you so much. Thanks
Not
for looking
a problem.
after my guy. I
You're
really
welcome.
appreciate it.
It's our pleasure.
I'm really happy that he's found you.
Yeah.
Thank
No,
you.
he's lovely. Archie's future's bright, I think. There's loads of people that are out there waiting for a bulldog like Archie. I think he's going to do really, really well.
Scotty loves you. I'll see you soon. Okay, bye, mate. Mwah. See ya.
Alex has brought in Bruiser and her new puppy Watson. Hard to tell which one is the patient.
So I've got Bruiser, who's a 7-year-old Yorkshire Terrier, and I've got Watson, who's a 14-week-old Beagle Cross. Play fighting is a bit of an issue in our household. So is finding people's underpants and chewing them.
All right, break it up, you two. Hi, Alex, how are you?
I'm okay, thank you.
Turns out it's Watson who's in trouble.
I think what we might do is I'll bring you and little Watson in the consult room.
Yep.
And I think your Bruiser might need a little bit of a break and a cuddle. So, Sam, would you mind taking this little guy? Hey?
Very sweet.
Come on through, Alex. Good boy. That's it. He is absolutely beautiful. But I can see straight away the problem is this right eye. So tell me, how did that happen?
I went away with work just for a night last week, and he was staying with friends. And they had a cat, and as you can see, he likes to play.
Mm-hmm.
And he wanted to play with the cat, and the cat didn't want to play. And the cat's just swiped, and I think the claw's gone straight in.
That's your crazy puppy ways that have not paid off, because cats generally won't have their claws out. They'll retract them and just pat them.
Yeah.
This wasn't a pat, clearly. Looking at the eye for the first time, I can see that there is major damage here. This cat has really done a number on poor little Watson. Well, look, I mean, this is a significant injury, and actually there's more than one.
So the pupil's not moving, or?
The pupil, sadly, isn't moving at all. And certainly when I'm putting this bright light on there, it should constrict.
Yeah.
So that either means that there's major damage within the eye causing that not to happen, or the light's simply not getting to the back of the eye, and the eye is not feeling this light, is not responding to it at all of which are not great signs.
I mean, I feel really sad, like really sad for him, because you always want to think that you could have done something more. I don't know, hopefully I'll stop feeling so guilty. He's a good boy.
Good boy, good boy. Watson's right eye is a ticking time bomb. Basically, at any point, it could become painful, it could become infected, leading to a huge amount of pain for him. It is not an eye that is going to get better.
Hey. Hey, Cheeky.
You're a good girl. Slow down, sweetheart.
Down at the River Thames, one of Scott's longtime clients is on her way in with a brand new patient.
The reason I like Scott as much as I do is because he's straightforward. So I'm a northerner living in the south of England, which has its issues. It's quite difficult. We're quite forthright, we're quite blunt, northern people, and Australians are too. Slowly, Mabes. Good girl. There's no more.
After her last dog, Ruck, passed away, Ali recently adopted 9-month-old Mabel from the Battersea Dogs Home.
She has issues. She's got a leg injury, which makes her, certainly that leg, uninsurable. Clean the camera on you, my baby girl. But, you know, she needed a home, and she needed someone who understood what she needed. We need to do some heel work, don't we, sweetheart? Yes, we do.
The attachment to Mabel's kneecap was torn away from her lower leg. Surgery has been done, but the puppy is still having problems.
So I'm taking Mabel to see Scott because I am interested in what he's going to suggest I do, or what I can do to help her, or what may happen if she needs surgery again. You're a good girl.
Put this stuff in your eye. It starts off orange and turns green, and then it'll bind to any damaged tissue on the eye. Okay.
14-week-old Watson's right eye has been slashed by a cat's claw.
Boy, I'm just going to put a little bit of water in there.
Owner Alex is feeling guilty after discovering the damage is permanent. While the eye remains, Watson will always suffer chronic pain.
I think the most upsetting thing is that I'm supposed to be looking after him and responsible for him. Like, he looks at me for everything and to look after him, and I feel like I haven't.
So I'm just going to shine a little bit of UV light in there now. The ulcer, the injury to the protective surface of the eye, the cornea, has already healed. And there's now a little scar that's present there.
Okay. So that's good news then, right?
I'd love to say it was good news, but sadly, the bigger problem is within. And what I can see is that your little puppy has a cataract that's formed. So what's happened is that this nail has gone so far in, it's actually punctured the lens. The lens is a structure that helps to focus light into the back of the eye, the retina, and then helps it to determine what image it's looking at. Sadly, we're looking at here is a dog that will lose the ability to see anything really but light and dark. And so then do we make the decision now, very heartbreaking decision, to actually remove the eye?
Okay.
So Alex, you've got one big decision ahead of you. This is something that is going to change his life forever.
I'm feeling a little bit kind of helpless. There's just nothing that I can do.
But let's see how the medication goes. Fingers crossed, you know, we'll hope for the best and prepare for the worst. Poor boy. At the end of the consultation, there really is only two ways to go. We're going to try and treat it, give it some medical treatment and just see, will it come right? But I really do feel in my heart of hearts that it won't. And I think Alex knows that.
You're beautiful, aren't you? You're a beautiful boy.
I'm going to see her again in a few days' time, and who knows, it might be a miracle. My guess is it won't, and we'll have to remove that eye.
We're going to go see Scott. Yes, we are. You're going to meet the vet.
Ali's now arrived at the clinic. She's looking forward to introducing her new rescue dog, Mabel, to Scott.
Oh, no one here. We'll just go straight through. We know where he is, don't we?
Hello, gorgeous.
Hiya.
Oh my goodness, so good to see you. Oh, but look, who is this?
This is Mabel.
Hello, gorgeous. Hello. Oh my word, she is absolutely beautiful. All right, let's pop you up, little lady. Oh, she's a little bit heavier than old Ruck used to be.
Ali started coming to the Aussie vet 6 years ago with her very first dog, an English Bull Terrier called Ruck.
It must be hard post-Ruck.
I'm glad he chose his own time and you didn't have to put a needle in him.
I'm really glad that I didn't have to on that day because I know I wouldn't have been able to keep it together.
Easy for you, I don't know.
And normally as a vet, you know, you can have a sort of a line. Sorry.
It's Remembrance Sunday, so I'm never going to forget.
On the day when I diagnosed Ruck's cancer, I could feel in his abdomen that something wasn't right, and my heart immediately sank.
The test results came back, and I said, how bad is it? He said, he's riddled with it. Which is tough to hear, and pretty tough, I would think, for Scott to say.
Ruck went through 20 cycles of chemotherapy. The prognosis? He would live no more than 6 months. He hung in for nearly 2 years.
Scott's care of Ruck definitely gave me extra time. He did, I believe, love my little man. So, yeah, he absolutely helped in that care. He did everything he could to make sure that Ruck was out of pain, living a full life. As a client or a friend or a dog lover and a dog owner, you can't ask for any more than that.
Yeah, it's emotional seeing you again. And
I mean, I can barely look at you right now.
No.
The little man, you know, you and me, all those mugs, he didn't make me.
There's another reason Scott admires Ali so much. While she was looking after Ruck, she was also battling breast cancer.
Ruck came with me to chemo. It was important to me, you know. I mean, I'm not that emotional. I don't talk about my feelings that much, but I talk to my dog, and having him there helped.
He was so brave. I mean, he's making us look like sooks right now, isn't
Yeah, he is, yeah.
What a monkey.
Yeah, move on, he'd say. So, yeah, and I know he would want me to give a dog a home. So, there's his little sister. You have got big boots to fill, my little man.
Massive boots.
Yeah.
Massive boots to fill, eh? No pressure, though. No pressure. Tell me a little bit about this leg.
There's a pin and 2 wires in there. It was a tibia crest avulsion.
Well, that's basically where the patella ligament has pulled away the attachment that it sits onto the tibia, the bone here in the back leg. So she's not a big fan of me straightening it up.
No.
And there's definite thickening around the knee and the joint. Are you finding that she is a bit lame still?
And most days she's fine. Occasionally she either plays with another dog too much and moves it, or I walk her too far, one of the two, or a bit of both, and she'll be a bit stiff.
So this is a process that we just need to go through a little bit of rehab work.
I'm up for it. I think anything that's going to help her, that I can do and encourage, has got to be a good thing.
Looking at her, I'm not convinced she's going to be a real water lover, but we're going to do something called hydrotherapy. It's a big word, isn't it?
Yeah.
It means swimming with you.
Whether she likes it or not, Mabel needs to be booked in for her first swimming pool session. This could be quite a challenge.
It'll help. It'll be good. It'll be good fun. It'll be good fun. It'll be good fun to hang out with you and go for a swim with your dog. just a standard day in the practice, yeah.
Yeah, that'll be good fun. I'm not so sure she'll think so, but we'll give it a go.
After 48 hours of soul-searching, Alex is back in the Richmond clinic with Bruiser and 14-week-old Watson.
Yeah, is he all right? Ready for the big op?
The lens of the puppy's right eye has been destroyed by a cat's claw.
I don't know, a bit worried.
Yeah. Anticipation.
Yeah.
Yeah.
So over the last couple of days, I've been thinking, because of the amount of pain that Watson's in and the long-term implications, I've decided it's best just to take the eye out. You've no idea what's going to go on, eh? I didn't want to accept that it had to happen. Because I think there's always just been that glimmer of hope that maybe he'll be able to keep the eye and it'll get better. But the more I've looked at it, the more I've noticed kind of actually how bad the damage is.
Even 7-year-old Bruiser seems to understand his annoying little brother is not quite his usual self.
He obviously has no idea, and he's been looking at me like, why are you so upset?
Okay, let me take your little boy. Come here, buddy. All right. I'm trying to give Mummy a kiss goodbye. Yeah. All right. I'll give you a call once he's woken up.
Okay, fantastic.
Okay. See you soon.
Thank you.
Bye.
Bye.
Come on, buddy. I really do feel for Alex, and it's sad, you know, you don't want to do what I'm going to have to do to a puppy, but I suppose that's part of the job of being a vet. Here he is.
Hello, little man.
Head vet nurse Emma will be assisting in the operation.
Oh, it doesn't seem quite right that he's got to lose an eye.
No.
Oh.
No, it's awful when you feel like you're changing their face forever.
I know. Bless his little heart.
But you've got a beautiful face regardless, haven't you?
Yeah.
Yeah. I'll just make you comfortable. Hmm? Come on then. Let's have a cuddle with Auntie Em. Good boy.
Hello, gorgeous boy. Today was the first time that I was able to get a proper look at Watson's eye, and it was really quite shocking. I've never seen one that bad in my career of nursing, so it was, yeah, it was definitely one of the worst.
Such a horrible injury to think that that claw's gone right in to the point where it's actually damaged the lens. It is eye-watering, pardon the pun, but it is. Hey?
Would he have been in quite a bit of pain from that? Yeah. I would imagine that's...
Absolutely, and now he's got an eye that literally doesn't work.
Yeah.
And there's a bit of a time bomb when it comes to discomfort, so that's why Alex has made the brave decision to take it out.
You'd be better off for it, little man.
Let's pop that catheter in, shall we? All right, it's in there now, honey bunch.
All right,
Good boy, brave boy, brave boy.
I know.
Brave boy. Just about to go into surgery on Watson's eye, and the main risks are that you might damage the optic nerve. Now, fair enough, you're going to remove the nerve going to this eye, but if you're a little bit too rough, you can actually affect the other eye. So it's a fraught thing because, of course, on one hand, we are removing one eye. You need to be damn sure that you're protecting the site in the other. All right, let's get going, shall we?
Wow.
So that's basically the lens that's just starting to leak out into the front of his eye. You can see the original injury, so that's where the cat's claw would have gone through.
It's really incredible. It's really incredible.
Yeah. So first of all, I suture the eyelids together. And I do that because then it allows me to take out not only the eye itself, but all the support structures associated with it.
It's a very interesting surgery from a medical point of view, but it's not one that you ever really want to do.
Yeah, maybe for people that don't do this job, a little gruesome.
Yes.
Okay. Right, so that part of it's done. What I do after I've sutured the eyelids together is then I just make a elliptical incision, so basically an incision around the outside of the eye, then remove the whole thing in a little bag almost, right back to the optic nerve and artery, which is tied off so it doesn't bleed.
How you doing up there, Doc?
Yep, all good. The top part of the eye is nice and separated, so that's getting there.
Yeah.
So now I'm at the crucial stage of cutting through the optic nerve. Cutting the nerve, obviously, this means I'm severing his chances of ever being able to see through the eye again. So this is definitely the no turn back moment.
Hey Marilyn, this is your new home.
While Watson's life is about to change because of a cat, over in Greenford, Scott's new vet Joe and vet nurse Gemma are on a house call, bringing an abandoned mother-to-be to a good Samaritan.
Come on then, Marilyn. Let's go meet Penny. Penny's going to be taking on Marilyn, and Marilyn's a stray cat who unfortunately has got herself pregnant. Naughty girl.
Hey,
Hi, Penny.
Hi, come on in.
This is Marilyn.
She's
Yeah.
got a name.
Yeah.
Penny is a very good old family friend of mine, and she absolutely loves cats. Not many people I know would take on a stray cat, let alone one that's pregnant, to have the kittens in their house.
Come on in. Right, where are we going to put her? Shall I move this across?
Yeah.
I really enjoy it. It's a lovely experience watching them grow and then have the kittens, and you know they're going to go to good homes because the vets will make sure of that. So it's really worthwhile doing, I think.
Maybe she can hang out on there.
What Penny's doing is amazing. This is going to obviously turn Penny's life a bit upside down for the next couple of months. It's a lot to take on, so it's really fantastic that she's willing to do that for us.
Where did you find Marilyn?
She was found in Chiswick, and the person who found her thought it was their cat who they lost. And then they realised it wasn't their cat when she started hissing at them.
That's terrible.
And then they got a photo and they realised it wasn't the same cat.
Oh my goodness, that's so bad.
Poor old
so
Marilyn.
Bad. Poor Marilyn.
The plan today is for Joe and Gemma to ultrasound Marilyn and check on the health of her unborn babies.
Should I start setting it up?
Yeah, if you set her up, and then Penny and I will let her out.
It should be a simple procedure, but Marilyn already has a reputation.
She is a little bit of a feisty madam, I'm not going to lie. She can scratch and bite.
I'll try and hold her, or do you want to hold her? You're the expert. Yeah, oops, there we go.
I don't think it's going to be an easy task.
Oh,
Baby on the nose.
Baby. Oh, look at this fur flying.
Blood pressure's good, all his vitals are good, temperature is nice and warm.
This is definitely the no turn back moment.
While Marilyn's lashing out at Gemma, back at the Richmond Practice, another cat victim, 14-week-old Watson, is about to lose his right eye.
So now I'm at the crucial stage of cutting through the optic nerve. Rather than maybe being too concerning, it's just sad. One painful eye now removed. What we need to do now is make sure he looks as handsome as he possibly can.
Yes.
With just one eye. So the plastic surgery part of this procedure commences.
Scott's now filling up Watson's eye cavity with protein collagen pieces.
How are we going, Doc? Getting close?
Yep, that's really starting to fill out nicely now. So we'll have a nice handsome Watson to give back to Alex.
Yeah, hopefully it's not going to be too much of a shock.
The surgery seems to have gone very well, and Watson seems to be waking up beautifully. He seems nice and comfortable, and he can still see out of the left eye. So, good result, really. There we go. Yeah, brave boy. Yeah. All over. Yeah, you've been such a brave boy. Yeah. Good boy. Well done. It's not very often that you have to knock out a puppy of his age, and he's still a baby. And of course, as a dad of 3, I like hugging babies. And he's such a cutie that, yeah, waking up from that anesthetic, he just needs a bit of cuddling and a bit of support. I'm more than happy to give that. You're such a sleepy boy, aren't you?
Oh, don't think about it.
Oh,
Baby on the nose.
baby. Oh, look at this fur flying.
Back at Penny's home, Gemma has just learnt an important lesson.
You all right?
I got bitten on the nose. Is it bleeding?
No.
I always get told not to put my face so close to the patients, but I like to try and comfort them. All right, young lady. I was trying to wipe my nose. Now I learned my lesson, why I shouldn't put my face close to them. Because you get your nose bit. Just gonna let her have a little wander.
You have a wander out, Marilyn.
Thanks, Joe, for bringing me on this home visit.
I shouldn't laugh because it is an occupational hazard, and I'm sure now I'm going to get savaged by my next patient.
It's not funny. I've got a nose piercing now to prove. And a few scratches. She didn't bite me too hard, she's just nervous, and she's probably protecting her babies. Maybe she's feeling maternal.
Maybe if you rock her back on your lap.
Oh, there we go, sweet pea.
After a short break to regroup, Joe and Gemma are trying once again to get Marilyn ready for her ultrasound.
It's all right, baby.
With a half-shaved,
It's all right.
and fully cranky cat,
All right, shush, shush, shush. Calm.
this mission is a long way from completion.
We're really struggling to shave her tummy without her taking chunks of flesh off us. We're going to have a look at your babies, Marilyn.
Right now, the feisty Marilyn is taking no prisoners.
Is she giving you a war wound?
It's only a little one, but there is blood.
Oh, so she's breaking the skin now.
So what do we turn to when this is happening? It's our secret weapon, treats.
Good girl, Marilyn. Come on, sweetie.
What do you think about the treats? I haven't done this with a patient before. Well, not a cat anyway, maybe a dog.
Oh.
That's looking good, Gemma.
So we managed to shave her tummy in preparation for the scan. However, it did take quite a lot of treats, but it needs must, and in some instances, this is what you have to do.
You got to do what you got to do.
Absolutely.
You enjoy that, Marilyn.
Come on, have some more, please.
That's the only time you're having a whole box in one sitting. Good girl.
Good girl, Marilyn.
Hey, we're going to see Watson soon, eh? Excited? Wonder what he's going to look like.
Later that afternoon, Alex arrives with Bruiser to pick up her puppy after his big operation.
I'm a bit nervous about seeing him when he comes out. I mean, I've had weird dreams where I've woken up and had one eye.
Okay then, Sleepy. It's time for you to go and see Mummy. Come on then. Let's go see her. Hello.
Where is he?
There's your boy.
Hey.
What do you think?
Yeah, he looks a bit weird.
It was really hard to gauge what Alex thought about the surgery. I think she was just plain shocked that he has changed and he's changed forever. So understandably, she was pretty speechless. Yeah, what did you expect, do you think, from the surgery?
I kind of thought that his eye would have sunk in a bit. Like, I didn't think it would be so, like, his eyes just shut. If you get what I mean?
Yeah. Well, that's actually the plan, is I filled his eye with some stuff that helps to keep it nice and puffed out and keeps it looking quite natural. So yeah, it's that sort of, I'm just winking. He's just winking for a long, long time. Now I think Mummy's desperate for a cuddle.
Yeah.
Go on then.
I think.
Don't play with cats. That's a rule to take out of this, I'd say.
Yeah, otherwise then you won't have any eyes left.
That would be very, very bad. Let's not go there. Just leave those cats alone, hey?
It's been a bit of a whirlwind and it's been really stressful, but at least like now, just like, it's over and we just need to get used to what's happened. But yeah, he doesn't look scary, like Frankenstein or anything.
All right,
Wonderful.
all the best. Great to see ya. See you, Bruiser.
Come on, Bruiser.
Bye, guys. Watson's a happy, healthy dog, and I'm sure he's going to have a great future. Yes, he's only got one eye, but he is a puppy, and he's really just going to get over it. As far as Alex is concerned, I think once she sees that Watson is embracing life and enjoying it, she's going to enjoy it with him too.
I just want to get him home and make sure that he's okay and then give him some chicken soup or something. Come on.
Scott can never be sure what each day will bring. Now he's on the road after being called out to an emergency.
So I've just had a call from a girl called Lucy, who's actually a veterinary nurse at Wildlife Aid. That's a band of dedicated animal carers who look after sick and injured wildlife. She's called me about an injured fox. Now, foxes in the UK, they're a little bit like Marmite. You kind of either love them or you hate them. But as a vet, that doesn't matter to me. It's not my agenda. It's all about helping injured animals. So of course I'm going to go and see it.
The Wildlife Aid Centre is 21 miles from London in Leatherhead, Surrey. Staffed mainly by volunteers, the team handles more than 20,000 wildlife emergencies every year.
Got all the equipment for you here. There's a towel.
Okay.
Some Kevlar
Vet
gloves.
nurse Lucy was on duty when the fox was rushed in.
Now, I caught her yesterday, so I'm going to get you to do it today.
Okay, she's around this way?
That's right, just around there.
All right, I'm going in. Wish me luck.
Good luck. She was brought in after being found limping around a garden. We expected that she'd been hit by a car. We could see it was a horrible fracture, so we needed to knock her out, give her an anaesthetic and then x-ray and have a look at the leg. I'm really concerned with what I've seen on that x-ray. I don't think the dressing is going to be enough, so we'll see what Scott says.
So whenever you're dealing with wild animals, at some point you have to catch them. So we're gonna grab her with a towel, hopefully not get bitten, and then take her out for a quick exam.
Good girl. Well done. Good girl.
Well, actually, I was pleasantly surprised.
Sweetheart, you are. Come on then.
I was able to catch her nice and quickly, and she was actually a really sweet girl, so I've decided to call her Sweetie. All right, Lisa, I've got that muzzle in my pocket, actually. Can you grab it?
Got it.
There you go. Thanks very much.
We actually put muzzles on foxes the wrong way up because it covers their eyes and it means that she doesn't panic so much.
Yeah, well, being a nocturnal animal, they probably enjoy being in the dark, do they?
And she's much more relaxed and easier to handle when they're like that. So the biggest concern that we've got regarding her leg is if her leg can't be fixed, it means she can't go back to the wild.
Certainly, I'm feeling a bit of pressure now because if this surgery doesn't go the way you want it to go, we'd have to put her to sleep.
Would you have a look at her x-rays and see if anything can be done for her?
All right, so should we try and pop her in the box then?
Good girl. That's it. So these are the x-rays that we took of the fox.
Yeah, it doesn't take much to see the problem, does it? Right there, so mid-radius ulnar or forelimb fracture there on this poor little lady. Oof, looks very, very swollen. Were the bones actually popping out of the skin? Was it an open fracture?
No, it's a closed fracture. There's no wounds at all, just the swelling, as you can see.
Yeah, no worries. Look, I will take the drive to Michael's and I'll call you as soon as I know anything. Okay?
Thank you.
All right, see ya.
Good luck, little one.
So for this, I think there's only one person in mind, one of my best mates, Michael Hamilton. He's a specialist orthopedic surgeon and he's the man. When it comes to fractures like this and important patients, then yep, he's the one to call.
Have I set it up okay? Is it working? Should we test it on something?
Right,
Test it on you just before we have the feisty cat.
We won't have long with her anyway.
No, exactly. My nose is still sore.
Back at Penny's house, it's taken a long time, but Joe and Gemma are finally ready to start feisty Marilyn's ultrasound.
There we go, that's deep enough.
Oh, I see a baby.
Oh, don't tell Scott.
Marilyn was found homeless and pregnant
Marilyn.
and is now being fostered by Penny until she has her kittens.
Hello, baby girl.
Let's have a look at your babies.
I think we won't have long to...
Ooh, you're about to bite me.
So the scan is really difficult to do because Marilyn is having none of it and she does not want us to scan her babies.
It's a good girl. Ooh.
Oh.
Yes, definitely.
Marilyn's determined not to make it easy.
Regular.
Okay, I'm just going to turn the light off so I can see the screen properly.
But Joe can finally detect some movement.
So, there's a heart. Let me just get a quick heart rate from kitten.
You can't tell how many there are at this stage, can you?
What I can see is she's definitely having more than one kitten. I can see them back to back in a view, two spines right next to each other, and they're moving around, so they're nice, healthy kittens.
You're going to be a mummy. You're going to be a good mummy, aren't you? Because you're going to protect them with that feisty spirit.
I am delighted that she's having more than one or two kittens. The more the merrier, as far as I'm concerned.
Okay, so I can see... Oh.
Right. Oh! Did you get everything you needed to see on there? Because she broke my watch and took my badge off.
I feel sorry for Marilyn that she's a stray at this time of her life. She's obviously quite a young cat. It's sad for her that she has to be fostered to have her kittens, but she's pretty lucky in the fact that she is now going to get a lovely new home and her kittens will find amazing homes.
Lovely to meet you, Penny. Take care. Bye, little one.
You'll see her soon, I'm
I
sure.
will. Maybe next time I see her, she'll have her babies.
Hopefully she'll have her babies, yes.
Can't wait to see them.
Oh, dear. Good girl, Marilyn. It's all right. I think I do have a bit of an affinity with cats. I really enjoy them. I really do. Even the naughty ones. Well, sometimes especially the naughty ones. All right, baby. It's just you and me for now. You going to be a good girl?
Scott has arrived at the Cherry Tree Veterinary Practice in High Wycombe, Buckinghamshire. Waiting inside for the injured fox is renowned orthopaedic surgeon Michael Hamilton.
Hello, mate. How you doing?
Scott and Michael became best mates 15 years ago, when they were single lads working together as locums in London.
Scotty's always been a hit with the ladies. He's a good-looking lad. He seems to be getting more handsome as he gets older as well, which is really, really annoying.
This is Sweetie.
Hello, you.
Seen the x-rays and things aren't looking very good. A fairly nasty fracture, so yeah.
Yeah, no, we can sort that. Yeah, we'll stick a plate on. Should be right as rain.
All right, should we go on through?
Good stuff, yeah, let's crack on. Follow me.
Michael is a Geordie. He says it like it is. He says it with a bit of colour, but he's a great surgeon.
So, Scotty, top of the box off or open the door?
Well, I think more to the point is that I got her in there, so I think it's fair that you get her out. Oh.
Interrupting?
Hello, Ems, come on in. It's BYO Vet Nurse Day today.
Oh, hello.
We're just trying to work out who's going to get the fox out of the box. He's got the expensive fingers, so I think it's going to be me again.
Hello, you're a bit gorgeous.
Emma's afternoon off has been cancelled. With Michael having no prior warning about Sweetie's surgery, the lads needed someone to help with the fox's anaesthetic.
So when I got the call from Scott about operating on this wild fox, I was really, really excited. Anything new that I've not seen before or not dealt with excites me, and orthopaedics as well. It was just brilliant.
Okay, yep, there we go. Thank you very much. Right, got her.
Yep.
The first muzzle of a fox.
First muzzle of a fox.
Wildlife need to come out absolutely perfectly, because if they don't, they just can't function in the wild. So sadly, as a vet, it means if we can't fix them, we have to put them to sleep. It's not a great proposition.
You happy?
Oh, it's static, yeah.
Nice.
Yep.
Michael will be fitting a compression plate inside the fox's leg to stabilise the fracture.
There we go.
It's a routine operation that he's performed countless times. But just as the surgery begins,
Oh, you're kidding me.
there is a major hiccup.
Seriously, man, this is not good. Repair loan drill. Thing.
Michael's personal drills were taken for servicing yesterday, and the replacement drill has failed.
Today of all days. If you swear enough, it'll work. Piece of repair loan drill. Thing.
At Cherry Tree Practice, specialist orthopaedic surgeon Michael Hamilton is struggling to stay calm.
Today of all days. Okay. If you swear enough, it'll work. Piece of shit.
The loan drill he's using for Sweetie the Fox's leg surgery has stopped working.
Right, plan B. Everybody think happy thoughts. Oh, you've got to be kidding me. Like, what the
No, I think that's understandable.
Oh, hello.
I honestly can't explain what went wrong with the drill, but it certainly seemed to respond to Michael's colourful language.
I'm not going to burn that up because we might just need to use that to put the screws in.
He was definitely sweating a little bit, was Michael. I think having to go back to using a hand drill was quite tough for him.
Michael Hamilton gone old school.
This is not even school. This is...
This is prehistoric.
With your hand, Scott, just pull the leg.
Yeah.
Right, that's it. No, that's fine. It's fine.
Yeah.
Wait a minute. If you can hold that one. Come on, drill. Come on, darling. Come on, darling. Once we've got 2 screws in, we're pretty much laughing. It's going all right now, as long as that drill keeps working. We've got a screw in the bottom there, look. Screw in the top there. The fracture line is under there somewhere. This fox is going to use this leg, hopefully, pretty much straight away.
With the crisis over in the operating theatre, Emma lightens the mood.
How many times have you two operated together?
Probably like at least a handful of times.
Yeah, probably not more than 10.
Must say I'm quite impressed with your equipment.
Thanks, mate.
Me too.
Thanks, Emma.
Thanks, Emma.
I like your equipment, but Michael's is just a little
Shinier.
shinier. Well done, boys. Well done.
We're not quite allowed to celebrate just yet until
Okay,
we've got
fine.
the X-rays. You're gonna do that.
Michael's a magician. He does such great work. Okay, X-ray. And it's a beautiful thing to see. And the plate is on really well. I reckon Sweetie's got a great future ahead of her. Yeah, it's great. Nice one. Well done, mate.
It's all right, mate. You'll be one.
Yeah.
Cool.
Waking up now. It was a long surgery, wasn't it? Good girl. What a sweetheart you are.
Hopefully we'll be seeing her running off into the wild in 5-6 weeks. She should do well. She's young, which is definitely in her favour.
Emma from Wildlife Aid will now take Sweetie back to Surrey for rehabilitation.
There you go, Emma. One fixed fox, all yours.
Thank you very much.
My pleasure. Take care. Bye, sweetie.
I'm very happy with the operation. She's a very lucky fox, so I'm glad for her.
Hi. Hello, Gemma. I was just about to get the kittens out.
Oh my God, they're so cute. I want to cuddle.
Oh, you better have one.
3 weeks later, Joe and Gemma are back at Penny's to check on Marilyn's new arrivals.
Pass them up. Hi. Hello. Oh my God, these kittens are so cute. They're just too adorable. I want to take them all home with me. Hello, babies. Oh, don't stand on your sister's head. So last time I saw Marilyn, she bit me on the nose, but this time she has been a model mum. She's been really, really lovely with her kittens, cleaning them and letting them feed from her. So she's been really great today, much calmer.
Nice strong heartbeat.
Good.
Can't hear any murmurs and the rhythm sounds good.
What are we doing to your baby, Marilyn?
It's all right.
Penny took Marilyn in when the young cat was pregnant and had nowhere to go.
Oh, look.
Oh,
You reaching for your baby?
a cuddle.
Now her 3 boys and 1 little girl all need names.
You're called Lulu.
You like Lulu?
Yeah, okay, I like Lulu.
And then this is Bob.
Right.
And this is Bert.
Oh dear.
And this is Alfonso.
No. That's no Alfonso.
We need a cute name for a little animal.
This is a Tim.
A Tim.
A Tim.
Oh, Bert.
Lulu, Bob, Bert, and Tim.
Aw.
I always find it really difficult to say goodbye to the kittens and the mums usually, but I know they're going to good homes and that's the main thing. I think it's very important that people do foster. There are so many creatures out there, you know, somebody's got to do it. I'm really proud to be able to do it.
Aww.
Oh, good girl.
Bruiser, come on, you're losing really badly. Come on.
As for Watson, having only 1 eye is clearly not holding him back.
I think he looks like he's got a battle scar. Like he's been in a war zone somewhere. So I think he looks like one of the cool kids in the park.
Hey, yeah. Hello, Trouble. Hello, mates. Look at you. Hey, aren't you looking fantastic? Hey? You're certainly not having any problems seeing, clearly.
No, he's been chasing his tail out of the socket.
No way. So out of the right-hand side, he's chasing his tail.
Yeah.
Wow. That's a pretty good sign that you're doing quite well. And then as far as sort of responding to the world now, he's only got the one beautiful brown eye left. How are you finding that? Is he doing well, coping okay?
Well, he gets more attention now, believe it or not.
Of course he does. Hey,
So-
he wouldn't stop for a one-eyed pooch, hey?
One-eyed Watson, he's now called
One-eyed
at work.
Watson. That
Yeah.
sounds good. Rolls off the tongue. It seems like Watson and Alex are doing fantastically well. Alex has still got a smile on her face after everything they've been through together. And Watson seems like he's just getting on with the job. I mean, he's still a naughty little puppy, getting on well with Bruiser and other dogs in the park. And also it seems that he's getting lots of attention from lots of other girls. Sounds like a terrible, terrible life. Good boy. Are you a good boy? Yeah? Yeah. Yeah. Well done. Well done, buddy. Well done. Yeah, good boy.
At Wildlife Aid, there's good news about Sweetie.
hand, that's perfect.
Michael's surgery has been a success, and the fox should be back in the wild in just a few weeks.
Nothing beats working with wild animals. So many times you let them go and you see them walking off and they look back as if to say thank you, and that's the best feeling in the world, it really is.
And at last, Scott's managed to schedule that appointment with Ali and Mabel.
Right, Ali, don't know if you know if she likes water.
She's not too bad around the puddles, but
yes, well,
I'm not so
hopefully...
sure about real water.
It's time for Mabel to start water therapy to strengthen her problem leg.
She's a big girl's blouse. Come on, you.
Okay, let's see if you like water, shall we?
Scott has volunteered to help with her first session.
Oh, she seems all right with it. Yeah.
Okay,
What's
Mabel,
this,
look.
Mabel, look.
Swimming pool, look at that. Come on, come a little bit closer. Good girl. Ali, if you come with me, she might follow.
Come on,
sweetie. Mabel's first impressions of the pool? Not great. Okay, so you go in first, and I'm just going to follow you behind, okay?
This way, Mabel. Good. I've known Scott a long time, but I've never seen him half naked. But I would again.
Come on, then. Come on. Come on. It's all right, honey.
Come on.
Brave girl, that's it.
Come on, sweetie. Come on. That's it.
Well done. Good. I think it might be a stretch to say she's enjoying it. I think she's tolerating it.
You've got to do the work yourself, kid.
Good girl, that's it, good girl. Mabel did surprisingly well. That left leg, not as flexible as the right, but that'll come with time with more swimming. Oh, wow, she's got some pace. Whoa, look at that go. Oh, hey. It's never a good thing as a vet to drown your clients. You know, it never goes down well, and that wasn't a highlight. Pretty funny though.
Good girl! Look at that! Hey, baby girl!
So, after a good swim the first time around, I thought, you know what? Every good lady deserves a spa treatment, so I had a little surprise in store for Ali and Mabel. All right. Let's wash up some of that wet dog smell, shall we?
I won't tell you what I was thinking. Me and Scott in the shower? Why not?
Everyone knows the cardinal rule is you do not pee in the shower. Oh, Mabel. Oh, my goodness me.
Did you need that, sweetheart? I was just a little bit embarrassed because your little girl's not behaving, but, you know, everyone wheezes in the shower, don't they? Don't they?
Nice. Ah. Oh.
Mum Melanie and her children Florence and Oscar.
Good boy, well done.
Their Labradoodle Herb has recently developed some worrying symptoms.
Herb is shaking his head, rubbing his head in the dirt, and he's generally not been himself. Herb, look, Florence has made you a card.
What's it say?
Dear Herbie, I hope you get well soon. From Florence, kiss, kiss, kiss.
Well, Florence and Oscar are worried about you, baby. Herb is absolutely part of the family. We couldn't be without him. If anyone asks us who's in the family, we mention Herb first, probably. He comes first in everything. Getting lots of hugs.
Hello, team. How you going? Hi, Herb. You guys like looking at my kids, eh? Like blonde people everywhere, including the dog. Hello, mates. Herb's had a few problems over the years, which means that he's a little less keen on visiting the vet practice compared to when he was a puppy. And today is one of those days. Come on, it's not going to be too bad. Come on. Good lad. Come on then, let's go. Come on, big guy. Come on, it's not going to be too bad. Good boy. Good boy. Well done.
Good lad.
There we go.
There you go.
We never want to find anything serious when it comes to a family pet, and that dog is very well loved. So I'm really hoping that we won't find anything too serious today.
Good boy, Herb. Good boy, good boy, good boy, good boy, good boy, good boy.
As soon as I look down the scope, there's something very dangerous and very nasty down there, and I'm quite worried about Herb.
Oh dear.
What a beautiful animal, aren't you? So handsome. I love you to bits. I really, really love you to bits.
Nearby, One of Scott's favourite patients, 3-year-old Archie, is having a morning cuddle before his appointment at the Richmond Practice.
Do you love me? Hey, do you love me as well? Do you? That's
74-year-old Peggy rescued the British Bulldog several months ago after a friend guilted her into it.
She said she had a Bulldog that needed a good home, and I said no. And then she said, but it's been in the rescue centre for 10 weeks now and it really needs a good home and you could look after it. So, having buttered me up, I said yes. Give us a kiss, go on. No, a proper one. Thank you, that was lovely. When I first saw Archie, I thought, that is a big dog. That is big. And he leapt up at me and scratched my hand and drew blood. And I thought, well, this is some kind of relationship here, isn't it, you know? I like to be treated rough. I love you. You're my baby, aren't you?
But as much as Peggy adored Archie, there were problems.
Would you like a massage, sir?
Firstly, the Bulldog wasn't house-trained.
He then started emptying his bladder in various places over the house, especially my bed, which I wasn't happy about. And I thought of changing his name to Niagara. How's that foot? Is it working today? Is it?
But within a few weeks, Peggy realised Archie was battling a far more serious issue.
He didn't want to walk. I took him to the park and all he wanted to do was to get back in the car. He wasn't interested in walking. I thought that was very strange. Oh, he's really bad.
Archie is now on medication, but lately the pain appears to be getting a lot worse.
I did feel really sorry for him. He was coping, but I know that they're stoic dogs and that they'll cope with things that other dogs can't cope with.
Today, the Bulldog is on his way to see Scott for x-rays.
I knew I'd taken on something that I might not be able to cope with. Let's go and say hello to the vet. Come on then, baby.
Good boy. Oh dear.
At St Margaret's, the news is not good for family favourite Herb.
Oh, yes, it's understandably sore, mate, because he has got a nasty grass seed in there. It's really, really far down the canal. I must admit, I'm a little concerned about his eardrum based on where it is, because it is so far down his ear that it could be perforating or rupturing his eardrum.
You poor love.
Grass seeds are really nasty little things. Basically, they're in the shape of an arrowhead, and every time a dog moves, it'll burrow further and further and further into the dog, and you're unable to pull them backwards because it flares, and it's just such a painful process for them to go through. So to see one in a very delicate position, teetered on the edge of an eardrum of a dog, it's serious. It's not a simple ear infection, I'm afraid. So we have to give him something to make him sleepy, and we'll get that pesky ear sorted out, and then once he's woken up, we'll give you a call and we'll talk it all through.
All right, lovely. Thank you very much. Oh,
thank you.
Good boy. Take me away.
Yes.
I couldn't ever imagine life without her.
He loves his teddy, don't you?
Come on then.
Say bye-bye. Can I say bye-bye to Herb? Yeah, give him a big hug.
That grass seed is lodged right at the base of the canal. It can go right into the middle ear. It can affect his balance. It can affect his nervous system. So there are some very serious ramifications.
Come here, sit. Good girl. High five. Very good. Sit. Down.
In Twickenham, Scott's new vet, Jo, is chilling out with her dog, Kimber, before she heads into the St Margaret's practice.
I've always wanted to be a vet since I was really young. I can't think of a time when there was more than a week that I wanted to do anything else but be a vet. I get you, folks. Oh, Kimmy.
The animal lover only graduated from university 2 years ago. and is enjoying her new position with Scott and his team.
It is a fun place to work. Lots of jokes and, you know, everybody's very empathetic and cares a lot about what they do as well.
You tired now? Eh?
I'm very lucky that I can bring my dog to work, but I did actually mention it in my job interview. That was a deal breaker. If Kimmy couldn't come to work, then I might not have taken the job.
Right, Kimmy is off to work. Bye, Bella. Bye, Jasper. Hey.
Right, let's go see a mouse now, Kimmy.
Hi, Herb.
Hey, so
Hello.
this is Herb, great name,
It's a brilliant name.
with Teddy and cards in hand, so we need to make sure they're
Okay,
ready to go.
interesting.
At St Margaret's, Scott and head vet nurse Emma are about to try to remove a grass seed lodged dangerously deep in Herb's ear canal.
He's going down now. I am worried that Herb's eardrum is perforated. Grass seeds can go right into the middle ear. It can affect his balance. It can affect his nervous system. So there are some very serious ramifications to a grass seed that goes past the eardrum. It's really bad. It's very, very deeply embedded. I'm almost certain this is going to have been down through his eardrum.
Oh, bless him.
At the St Margaret's practice, Scott is attempting to remove a grass seed buried deep in Herb's ear.
That is nasty.
Ooh, that's huge.
Can you think of that trying to burrow into your head?
Oh.
The grass seed we removed from Herb's ear is a nasty one. Very, very sharp. It's got the feathered edges, so it was only going in one direction, and that's going right through Herb's ear and then into his middle ear. That is exceptionally painful and cause a huge amount of damage.
One to show Mum.
I think Herb would have been in a huge amount of pain. Surprising that he's really not showing those clinical signs. He's a very calm, easygoing fella, but I tell you what, if I had an ear that was full of grass seeds, I'd be screaming my head off. Let's have a little look at his eardrum now.
There's a lot of blood and damage down there and infection, but unfortunately I can see a bit of a hole.
These grass seeds are very damaging to animals, and when they burrow into that level, they can cause all sorts of neurological dysfunctions. I think in this case, we've caught it just in time, because if it was any longer, it could have been a lot worse.
Oh, there's one. There he is. Oh, he was starting to work his way in.
Scott and Emma are now searching for any other grass seeds that may be camouflaged in Herb's golden fur.
Oh, there's another one.
Oh, and here as well. Add it to the pile.
Grass seeds aren't as simple as just a prickle in the foot. They can be a real disaster. They actually can harpoon any organ that they find on their way through a dog's body, and they'll only really stop when there's bone. They can cause real problems.
They're so sharp and so spiky.
Nasty little things, aren't they? We get to 9 in total. Poor old Herb, he was focusing on his sore ear, but in fact all the while he had feet absolutely riddled with grass seeds. And no wonder he wasn't himself, poor guy.
No. Braver than I would have been.
With all the grass seeds removed, Herb will spend the afternoon sleeping off the sedation.
Aw, he's going to want his Teddy to wake up with.
Of course he is.
I
There you
would.
go, mate. The damage that we've found in Herb's eardrum is significant, but I do hope it'll heal up and eventually he can get back to his water-loving ways. Good lad.
Good morning, Vet St Margaret's. Yes, of course. What's the surname?
While Herb's recovering downstairs, Nathan's about to surprise the new vet Joe with an exotic patient.
So a friend of mine has gone away and left me with these snakes. He's fairly new to the hobby and I'm not sure he's got it quite right. Hey Joe, I've got something special for you.
What's in the bag?
Well, I've been looking after some snakes for a friend.
Snakes. Nathan, it's my first week. Why have you brought me a snake?
When I first put the pillowcases down, I saw Joe look like she wanted to kill me, but really, she should treat them. She's a vet.
Fortunately for the apprehensive Joe, only one of the snakes needs medical attention.
So this one's Margaret, as in Snake in St Margaret's.
Oh, me, Margaret.
I think she's just had a shed.
Okay.
But I don't think it's quite gone as well as it should have.
Nathan is worried that Margaret is having trouble breathing and has developed a nasty discharge around her mouth.
Well, it looks quite bad around the front, doesn't it? It's quite a bit of discharge. Let me see that. If that was a poodle walking through the door, I'd be at ease and confident, but this is really new to me. So I can see she's got quite a bit of froth in the corner of her mouth. Has she been open mouth breathing?
Yeah, making sort of like a gargling noise.
She really does look like she's in a bit of trouble.
Remember, snakes only have one lung. So.
Yeah. Trying to think back, and I can't think of any snake-specific lecture. Oh, it is crackly. So I probably spent about half an hour on snakes, and it wasn't on snake respiratory tract disease either.
Treating this python is way out of Jo's comfort zone. She's relying on Nathan, who's the practice's reptile expert and has owned snakes for 15 years.
So a lot of people get snakes thinking it's cool, unusual, which it is, but they don't always get everything right.
Do you know how they're kept?
Well,
ventilation, temperature?
I just don't think there's enough ventilation in the boxes for them. I think this is one of the big problems now. I think a lot of people are buying them, but the equipment's so expensive to start out with that they try and do it on a budget.
I think the most likely thing is probably bacterial, but of course we don't know if she's got an underlying disease. I think we give her the antibiotics for a week and then see if she's still showing clinical signs, we might do a swab and check for the other diseases they can get. But I think she needs some antibiotics now. I like to feel like I know what I'm doing. Despite how many years we spent at university, we still often have to go back to a textbook or the formula and look up what we're going to do.
It's time for some quick research, but Jo is still suspicious that her boss may have had something to do with this challenging patient.
So I thought maybe Scott had put them up to this. Scott would be capable of that. I imagine him putting me through a test on my first week, for sure.
So Jess, what do we have on this afternoon?
We've got Archie in today.
Archie.
He's a good boy, isn't he?
At the Richmond Practice, vet nurse Ryan is teasing his colleague Jess about their next patient.
Have you got him out the car before?
No, I haven't.
I think it'll be good for your training.
Okay, we'll see how that goes then.
It's definitely your turn.
Okay.
Outside, Peggy and the infamous Archie are just pulling up. To make it easier for the bulky Bulldog to get in and out of the car, Peggy removed the front passenger seat.
Archie laid claim to the car. I think he must have lived in a car. It must have been his kennel, if you like, because he made it his own.
Come on.
And he didn't like other people, especially men, trying to get him out of the car.
Hey, Archie. Hey! It's an overwhelming feeling of dread. There's a serious risk of losing an arm. Come on. I think we need Scott.
Definitely.
Yes, okay. So Jess and I looked at each other and we said, do you know what? We admit defeat. It's time for Scott. Neither of us are that brave. It's his practice, it's his arm.
Come on. No. Excuse me. Bad behaviour is not tolerated. Come on. Right. There we go. That was a bit naughty, wasn't it? Come on in, you old grump. Here we go. Come on. I first met Peggy and Archie in the clinic, and straight away I thought, this is an odd couple. Gee, he's walking like an old man in a young dog's body. Archie's a handful, there's no doubt about that. And it's not just the physical problems that he's got going on, but also the behavioural, the mental ones. But Peggy just wants to do the best for Archie, and I salute her for that. She's an absolute star.
You're extra grumpy. It just shows you're extra sore, doesn't it, you poor boy?
Have you given an injection to a snake?
Yeah, I've given a few.
Well, that's more than me. I haven't done one yet.
Margaret, the royal python, has been diagnosed with severe respiratory problems. This is Jo's first reptile patient in her short veterinary career.
Poor Margaret. Look at all those bubbles. It must be really difficult for her to breathe. I know that I want to give her a type of antibiotic, but I need to know which one and I need to know the dose.
But while Joe's doing her sums, Margaret decides to put on a show.
Oh, look at all of that. Wowee.
Wow.
Oh, I bet she loves that.
Snake shedding is always a beautiful thing. It's like a new beginning, new skin. What's not to like?
Wow, that skin underneath looks so much better, doesn't it? That's beautiful.
With Margaret's strip show complete, it's finally time for her antibiotic injection.
So I want to go around here where it's most sort of fat and muscly.
Oh dear. That looked a bit painful, hey? You can kind of tell by the way she's moving that she's a bit stressed about it.
It's the last bit. Okay. That's great. Just rub that in.
All done, Margaret. Hey, that'll kick in soon. You'll feel much better. This is like the snake practical that I never had. Gosh, look at all that. She will feel better without that in her face. Ugh. When Nathan was cleaning that discharge from around her face, I couldn't believe how much was coming out. It was all under her lip. And she just looked like a new snake when we got rid of that. Do we go tail first?
Yeah, let's put in the tail and just get her settled in a little bit.
And finally, Margaret's reward, a nice warm bath.
It sounds weird, but I had no idea that a snake could fart. Oh, she has piles something at the bottom.
Yep, nice bit of snake poo there. Reptiles have this thing that every time they get in water, they get really relaxed, and you often might find a few bit of whoopsies in there. So glad all that shed's come off now.
She looks so much better. It's like a different snake, Margaret. Margaret's going to go home with a course of antibiotics, and I've recommended more baths for her to have, and I'm hoping that in a couple of weeks that'll clear up the respiratory tract infection and she can live a happy little snake life.
Thanks a lot for that, Jo.
Okay. Well, thanks for teaching me how to give an IM to a snake. And now I am the new snake vet. I'm ready for my next snake case.
A little feel of those elbows. Wow, they're feeling very, very thickened and actually quite swollen at the moment. Good boy.
Back at Richmond, Scott's trying to find out why 3-year-old Archie is walking like a geriatric.
So what I'm feeling here, Peggy, is just a sort of feeling almost of nuts and bolts under the skin. So there's little bits of bone that are rolling about in that joint. I always think of him as almost like a bodybuilder, you know, they go, ooh, and they sort of, they pump up.
Yes,
And he's sort of doing that at the front.
Yes.
And by doing so, he's sort of top-loading the front part of his body, and I think that's just wearing him out quicker than he should be. For a 3-year-old, I would never expect arthritis. Archie, yep. That's it. Good boy. Well done.
X-rays should give Scott the answers.
Good lad. Good lad. Oh, it's times like this I wish we invested in an elevator.
Hi, big boy.
Come on, it's like carrying a furry rhino. I absolutely love Archie. He is like having a bromance with a dog. He's this big, burly, blokey dog.
You got your fingers and toes out the way?
Yeah, all out the way. All important appendages out the way. Good boy. These are terrible elbows. It's a tragic story if we do find that he does have arthritis.
X-rays?
He's chilled out a little bit now, hey? You relaxed?
I'm certainly warming to him more now.
Yeah, I mean,
he's a good boy.
He's a champ. He's just misunderstood, but he's grumpy for a very good reason, aren't you? Because you just saw.
At the Richmond clinic, Scott and Ryan are waiting for Archie's X-ray results. After nearly taking Ryan's hand off earlier, there's been a truce between vet nurse and Bulldog.
It was great to see Ryan finally be able to see the good side of Archie, the happy side, the non-bitey side.
I forgive you. I do.
Whenever he's not in that car, he always acts beautifully, and he's a perfect gentleman for me. All right, Peggy, I've got your boy. Can't stop, he's heavy. You follow me in. There we go. In you come.
Worried owner Peggy is about to find out just how much trouble her Archie is in.
This is his elbow joint here. And what you can see is these white bits of fluff. That's arthritic change. That's what's causing the problem. We've got new bone, we've got bone breaking down, building up all at the same time. And that's that nuts and bolts that I can hear and what I can feel when I flex and extend his elbow. The x-rays are concerning. Archie's just 3 years old, which works out to about 21 human years. It's like a young man, but with joints of a granddad. There's no drug that exists that's going to fix that. What we need to do is something quite brave, which is to go for arthroscopy. What arthroscopy is basically placing instruments into the joint to actually clean all those changes out of the joint. And I've got, luckily enough, a very, very good mate who is very good at arthroscopy, and I know that he's going to take very good care of you and Archie.
I think it's wonderful, I really do. It gives him another chance and a chance to get back on his feet, literally. Wonderful. I didn't think there was an operation. I thought this was how it was going to be and it would only get worse. So it was like another door opening, actually. I was absolutely delighted.
Later that day at St Margaret's, Joe's dog Kimber has taken over reception.
Hello. Is this the new receptionist?
Yeah.
It's a special welcome for Melanie, Florence and Oscar.
If only. Yeah, shame she's a rubbish typist. Absolutely rubbish, aren't you?
They're all anxious to find out just what's happened to their Herb.
When the kids left here, they were really anxious. They suddenly went into complete mode of, oh, we want to be with Herb, we want to be with Herb, will he be all right? What will they do to him? How's our Herb?
He's been such a brave boy, but it's a very serious finding that the eardrum on that left side has been perforated, unfortunately.
Oh,
so he's got a hole in the eardrum. So where that grass seed, which is this nasty little thing, look at that, kids, look.
Oh my gosh, that's huge. Oh.
It's gross, isn't it?
Oh. Yeah, I imagined a grass seed to be the size of a pinhead, but it was a lot bigger than I thought, and it was spiky on the end, so nasty. Oh.
So thankfully it's out. We've flushed his ear canals, but the hole's a decent size. It might heal, it might not. If we get water down there, that can affect his balance, it can cause infections, it can even affect his neurological systems.
Oh. I don't know how Herb will handle not swimming. He loves swimming in the sea. I mean, he loves the sea.
But also, what you guys have got to promise me is that you need to start looking between his toes after every walk. The reason being is that I found not 1, not 2, but 9 grass seeds between his toes.
Oh my Lord.
See all of them?
Oh, it's horrible. It was pretty horrifying, really.
Now, guys, just so you know, he's just had an anaesthetic, so he might be a little bit woozy, look a little bit drunk, okay?
Oh no.
It's been on the wine.
Drunk man.
It doesn't get that from me, by the way.
I know.
It's not from
It's
me.
very authentic.
Yeah.
Herb is pretty desperate to get home. We could see he wasn't keen on coming into the practice, but he's very keen to get out. Good boy. That's it.
Show me the dog. Where's my Herb? Give me my animal.
Yeah.
Hey, baby.
Here we go. Who's this?
Hello.
Whoa. There we go. Herb's done so well, brave mite, and I think even though he's a bit wobbly, I think that he's going to be much happier at home, snuggling up with Melanie and the kids, and of course his cute little soft toy.
Where are you going to put the grass seeds?
Do you want to keep it for show and tell?
Yeah.
Yeah?
I want to keep it for show and tell.
Herb's been really lucky this time, so I'm glad we got him into the vet and we've got it all sorted in time and hopefully he'll be fine now. Thanks
All
very
right,
much.
Take care, no
Thank
worries.
you.
See you
Like
later.
you
Bye,
say,
Florence
you want to say
Pasca.
thank you?
Bye, Herb. And soft toy and card. Lovely.
Come on then, guys, off we toddle.
Scott, look at you and see what's going to go on. See what's going to go on with the baby. Here we go. Here we go.
Next day...
Hey, John, how you going?
Scott's first appointment is American John and his much-loved 17-year-old Sadie.
Let's go on through and get her out of this wet weather. Hello, old
There we are. Hey, baby.
Hello, sweetheart. John absolutely loves his cat and he gives no excuses. And I think it's fantastic. Good girl. There we go. I know, you're so good. Well done.
I do find it reassuring in Britain that I'm not looked on as the eccentric cat guy. It's the British madness about their animals dovetails in wonderfully with how I feel.
Okay, gorgeous. Let's have a little look at you now. Yeah, good girl. 18, you said, didn't you?
18 next month.
What sort of events do we think we're gonna organise for her?
Well, certainly her first pint. Take the pram into the pub. I'm sure they'll love that. And,
yeah, what kind of reaction do you get when you bring the cat pram into a public space?
well, they normally think it's the baby pram until they hear the meowing, and then we get quite the look. Oh, hey, who's your friends?
I thought you had a baby.
No, it's the cat. I say, uh-oh.
Oh, he doesn't, yeah, he's not best friendly to...
Oh, that's okay. All right, see you guys. Bye now. There's some nice puppies.
John and his wife Tracy moved from the United States to the UK 2 years ago.
The pram thing came about when we first moved over. We didn't have a car, and in America you have to have a car for everything. So we didn't think about how we were going to get Sadie from home to the vet. There you go. Hey, sweetie.
He struts up here, Richmond Hill, with his cat in a pram. He's loud and proud. He's out there, I love my cat and she loves me. Good on him.
Don't take her out too often because she usually thinks she's coming here. Come on now.
No offense.
But today, John is worried about his aging sweetheart.
John, I tell you what, she is looking thin, isn't she?
Yeah, she's feeling more and more bony.
Yeah, I can feel your ribs.
It was only 2 years ago that Sadie's sibling Peanut died from kidney disease.
Her brother cat, Peanut, had the same noticeable signs of the weight loss. And we noticed with his haunches getting skinnier and the back getting ricketier. And so we saw that happening with Sadie and we decided to bring her in and see what you have to say about it.
Sean, what I can tell you about the weight that we've found today is that she is 2.5 kilograms. She has been up to 4 kilograms back 3 years ago. That's a huge amount of weight for us to lose. So you or I losing nearly half of our body weight. So for a cat, it certainly shows that there is definitely some problems afoot. We do need to look into this pretty seriously.
Meanwhile, Peggy and Archie are on the road to High Wycombe to see specialist orthopaedic surgeon Michael Hamilton.
My friend Rod is going to take me to the surgery and he's got a wonderful car, so we'll arrive like royalty, and that's what Archie likes. He likes to be a bit royal.
This time, the feisty Archie gets out of the car without a fight.
Right. Oh, what a little treasure. Here we are.
Getting him out of the car was really easy this morning. We had no trouble at all.
Oh, what a good boy.
No temperament or anything. He just came out easily.
Okay, so just extension first of all. Ready, 1, 2, 3.
Scott's already sent Archie's x-rays, and Michael is now using the hands-on approach.
He's interested. And then this little specific test. Right, ready? Ready, 1, 2, 3. Hello, hello. Sorry, big man. I'm just going to do that again. Right, ready, 1, 2, 3. Oh. There we go. Oh, still friends. Still friends. There we go. I think that's quite conclusive, isn't it? Okay. Well done, you. I got his elbow joint there and I just kind of rubbed it and I poked him right on that little spot there.
Yes.
And that little spot there, that little corner of bone, very commonly is the bit that just sits a bit proud. So if this is his radius here, and this is the notch of his ulna here like that, that should be a perfect fit. If it's not a perfect fit, and that little corner of bone maybe sits a little bit proud like that, it can start to rub, or little bits can start to crack off. And when I poked in there, we got quite a reaction.
Yes.
And for a bulldog, that's probably quite significant.
Yes, yes.
So this is a really, really frustrating disease to treat. There is no magic bullet. The point of today was to see where we are. The plan, I put the camera in, see what we find. Based on what we find depends on what we do. But we're not going to be massively aggressive because we don't need him to start kind of, you know, catching the bad guys like the Met Police dogs need to do, kind of thing. We just need to get him out of pain, basically.
Just a bit stressed, that's all. And can't wait to get down the pub for a gin and tonic.
Oh, look at that. Flying along. Come on, you. This way. This way. He's a good boy. I'll speak to you soon, Peggy.
Okay.
Take care.
Yes.
Come on, then.
Thank you.
Be a good girl.
At the Richmond Practice, John has just found out that Sadie is losing a dangerous amount of weight.
It's been steadily dropping, but it's really dropped this time round, so I really do want to get to grips as to why. And obviously she is not the biggest fan of the vet practice, so we take that into account when we hear a slightly higher heart rate, but her heart rate is pretty fast.
Yeah.
I think in this instance, she's showing fairly classic signs of an old lady, an old cat. There's a number of different things that this could possibly be. First thing we'll be doing today is taking a blood sample, and we'll be looking at not only kidney function, but also her thyroid level as well. And the other thing is just checking her blood pressure, because when a cat has got high thyroid level or high thyroid hormone, it does drive up their blood pressure. And that we need to determine now, because in future, if we start to treat it and the blood pressure drops, we might see its effect on kidneys. When we see a relationship as close as John and Sadie, I don't want to be the bringer of bad news.
You sweet thing. That's a good girl. I work at home as a computer programmer. I am with her 24 hours a day, and from the time I wake up, she's spent the night in bed. I have to carry her on my shoulders to get ready in the morning, put that pot of coffee on, come downstairs, and then she's in my lap all day. She demands love pretty much 24/7. So it's certainly a very hands-on relationship, but it's one I think that she really enjoys. She really enjoys just having me there all the time.
So let me get this right.
Oh yeah.
You work from home.
Yes.
With your cat all day.
Yes.
The cat has a cat pram that you bring to the vet clinic, and now I find out that she actually is your bedfellow.
Bedfellow, yes.
Does your wife at all feel jealous in this situation?
I think she understands that Sadie kind of came before the marriage, so.
Right, and of course the cat can't use your credit card, so I suppose she gets her own back.
Not that I know of.
The British love their animals to the point of obsession, and I definitely think that John is the poster boy for the American contingent of mad cat people. All right then, John, well, I'm going to take you now, and we'll start doing the blood pressure and the bloods, but I will be looking after your beloved. Come on then, I know. You love your daddy, don't you?
You guys first.
Of course, she's 18. She isn't going to last forever, and today is all about finding out how long she might last for. All right, I'll get as much information as quick as I can for you, okay?
Okay. See you in a bit.
Hello, Archie.
Sleepy, sleepy.
At the Cherry Tree Practice, specialist orthopaedic surgeon Michael Hamilton is about to begin an arthroscopy to find out why 4-year-old Archie walks like an old man.
So his elbow is a bit like an old person's knee, and if he was an old person, the doctors would be talking about things like knee replacement. So this is the actual arthroscope, which is going to illuminate inside the joint. That's then transmitted to this thing, which is a camera, which then gets made into a picture of what we're going to see inside the joint.
Owner Peggy is hoping this surgery will improve her Archie's quality of life.
I hope that I'll be frolicking through the park soon. Yes, I do. With my dog, of course, not on my own.
Camera goes in. My first impression, having just got the camera in, is this does not look very nice at all. All that red stuff there, that's inflammation of his joint capsule. He's got arthritis, he's had it for ages. That there, on the bottom of the screen, is red bone. So as soon as the camera went in, first thing you could see, red bone. What you want to see is white, shiny, articular cartilage. Straight away, red bone is not good news. That is his ulnar that I was hoping just to see a little crack in there. That's got no cartilage on it. This dog has got really, really severe cartilage erosion. That means that the less invasive options for him are not on the table anymore. The only options he's got surgically are pretty full-on procedures, cutting bones, plates and screws.
Michael's now decided to use a cutting-edge therapy. A platelet-rich plasma injection using Archie's own blood will be injected into his elbow.
Success. Fair enough. What we've done is we've taken a blood sample from him and we've treated it in such a way that we've collected these little things called platelets, which will release these little anti-inflammatory proteins, and we put those into the joint, into his elbow joint. And that will do nothing for the cartilage, but what it will do is it'll hopefully make the whole joint just less angry, less inflamed, and less painful. Done. And I'm happy a dog, and a happy owner, and a happy vet.
It's time to transfer the beefy Archie into a recovery cage. Michael can't resist having a go at his good mate.
I don't know what Scott was moaning about. He's light as a feather. I could lift him with one arm. I don't know what Scott's banging on about. He's got significant loss of cartilage in his elbow joint. So it's not great news with regard to the cartilage that he's got. So it was a bit of a nasty surprise we got, rather than a nice surprise. Okay. Now he doesn't know that though.
No.
Don't tell him.
No,
okay?
I won't. I'm not shocked or surprised. I thought that there was something pretty serious going on.
Here he comes. Here he comes.
Archie! Archie, baby! Oh, my little baby!
So he wins a little rosette for being brave. So the plasma injection, that will hopefully make him feel a whole lot better. For how long? How long's a piece of string? Hopefully long term. He's getting the cutting edge treatment, you know, this is kind of what they do in people. So your job, difficult as it might is, try and get him as lean as you can.
Yes, I can do that. I will definitely
Sorry,
do
mate.
That. If you have to see him again, there'll be less of him to see.
Good stuff.
Thank you very much.
All the best.
Thank
you
you,
take care of each other. See you, Archie. If we can just get him to have his walk in the park with Peggy, that's what it's all about. And I would be optimistic we can get there. And if that needs surgery down the line, fair enough. But for now, all hope's on the plasma. So we'll see how we get on.
Look at that. He's walking better already.
Hey guys, I've got John's mistress here. We need to
hello.
treat her very, very delicately.
Hi,
She's lost quite a bit of weight of late, so we're just going to look into that a bit.
Back at Richmond, Scott's about to start investigating why 17-year-old Grand Dame Sadie is losing a dangerous amount of weight.
You know, it's funny when I'm consulting with John and Sadie is that you almost feel like you shouldn't be in the room, like you're like the third wheel. You know?
There's so much love between the two of them.
Yeah. So I need to make sure that she is passed back to him in an equal state.
Indeed.
Of love and devotion.
Dedicated dad John is not going anywhere. He's just hoping Sadie makes it through to her milestone 18th birthday.
It's tough seeing what she's going through now. I can't imagine her being gone. She's been in my life longer than my wife, and if a cat of 18, hopefully 19 or 20 years, once she's gone, it'll be devastating.
So the first thing we're going to do is just try this blood pressure out. The conditions in Sadie's case most likely are going to be kidney disease in the form of renal failure, where the kidneys fail to function as well as they used to. Not too high at 130, that's perfect. Hypothyroidism is the next possibility, and that is basically where a cat produces an excessive amount of thyroid hormone.
Good girl. Good girl.
Usually because they've got a benign growth that's growing on their thyroid gland in their neck.
What a good girl.
And that basically drives their metabolic rate very, very fast. So they eat for England and yet lose weight. Sodium potassium ratio is normal.
Good.
Everything pretty good.
For a 17-year-old?
Good results to pass back to John. Sadie, so I don't think you're going to be impressed with the lifestyle changes that I'm going to implement, but I think it will help you get to that 18th birthday. It's a massive relief today for me to find out that Sadie's health is intact. There we go, here's Daddy.
Hey, baby.
There you go. All right, so she was so good, incredibly good. And the news is good.
Okay, great.
Of course, we have to take into account she has lost the amount of weight she's lost. So we do need to keep a very close eye on your lady, but Her kidneys are functioning not too badly.
Okay.
And she doesn't have hypothyroidism. So,
wonderful.
So far, so very good. And one thing we are going to have to do is to just change her lifestyle a little. So what we're going to do is enact a new type of food. So it'll just bring down the amount of protein she consumes, just brings down the amount of work the kidneys have to do as well. So with that simple lifestyle change of changing the food that she's eating, I think that Sadie will absolutely breeze through to that 18th birthday. And I don't think, though, that she can really drink a pint, but John and I are more than happy to enjoy it for her.
Okay, thanks. See you soon.
See you soon.
Okay,
all the best.
Thanks.
Bye-bye.
Here we go, baby.
Yes, beautiful boy. Beautiful boy.
It's been 2 weeks since Archie received his magic plasma injection.
I don't know what this plasma was or what it consists of, but it certainly worked for Archie. He's walking much, much better. It's not a permanent solution, but it's certainly making his life more comfortable. There is a light at the end of the tunnel. Now there's some hope for him, and quite honestly, I'd lost hope. I think I'm on my way to getting a new British Bulldog.
That is very good. Wonderful.
Good girl. Happy birthday, Sadie.
And Sadie has made it to her big birthday milestone.
Is that tasty?
John's invited Scott to the celebration.
Oh, I felt incredibly privileged to be invited to Sadie's 18th birthday. It's not very often that you get to have a beer with a client, but a beer with a client in a pub with a cat in a pram turning 18, that's special. All right, and I see you've got a nice little birthday card. Do you mind if I open it on her behalf?
Oh, please do.
Okay, let's have a look at Sadie.
There you go, Sadie.
There you go. Look. Do you want to read it? It's your birthday today. Happy birthday, Sadie. Thanks for 18 amazing years, hoping for a few more healthy ones together. Love, Mummy and Daddy. Ah, isn't that nice? Hey, isn't that lovely?
Not so happy, huh?
Yeah. I'm not convinced that Sadie was particularly happy with me being at the pub with John, her beloved. Quite frankly, I think she would have ditched the beer and the pub for a lovely snuggle back at home, listening to just the two of us. Cheers.
There you go. Cheers.
Happy 18th birthday.
Thank you.
Hey?
Happy 18th birthday, Sadie.
Good girl.
It's been a good run.
Very good.
Oh, sorry. Sorry.
Doggy babysitters Natasha and her son Josiah have arrived at the Richmond clinic with 8-year-old Bam Bam.
We'll see the vet shortly. I'll fix you up nice and better.
Don't worry, Bam Bam.
Yeah. We brought Bam Bam in today because we found that Bam Bam was getting a bit lethargic and he wasn't eating his food like he normally does. And he was just constantly drinking water and constantly going to the toilet, which we found very worrying. Don't worry, your mummy will be back very shortly. You'll be able to see your mummy soon, yeah?
The Maltese Terrier's owner, Alyssa, is overseas.
So far, we've been looking after him for the last 2 weeks, and we've noticed that within the last few days is when his health has deteriorated. Looking at the way that he is and how frail he is, we are a bit scared, I have to say.
Hi there, guys. How you doing?
Hi.
Hello. Hi, Bam Bam. Oh, buddy, you're not looking so well, are you? All right. Come on into the console. Let's have a better look, shall we? Bam Bam is in a really bad way. You can see straight away that he's shivering, he's shaking, he looks very, very quiet. I know Alyssa, and I know how much she loves this dog. Yes. So I think it's very important that we've got a chance to see him today. Let's just unwrap him and see what we've got. Oh my goodness, you have shrunk. What has happened to you, mate? Bam Bam and his mum Alyssa are regular clients of ours, and to see Bam Bam literally have shrunk before my very eyes is concerning indeed. So you say he's been drinking a lot?
Yes.
And he's been then urinating a lot?
Yes.
Not been eating particularly well?
No. Well, no food at all within the last 3 days.
Wow.
Yeah.
Oh, Bam Bam, buddy. Hey, let's have a little look at you. If I get you just to pop your hands around his shoulders there. Thank you. He's looking a little bit pale. His gums are a little pale there. He's definitely a little bit dehydrated, which is amazing when you see him drinking so much.
Yes.
You think, of course, he's drinking enough to keep him well hydrated, but in this case, not. Let's spin him around. Good boy, good boy. There you go, you're just a skin and bone. Lucky he's got all this fur. It's certainly hiding the fact that he is exceptionally thin.
Yes.
His bones are sticking out of his skin and he's very, very weak. This is not a well dog. So let's just pop him on the scales. Good boy. Good lad. Good lad. It's okay. He's actually lost about half of his body weight. He was 4.6 the last time I saw him, and he's now 2.6. Okay. When patients come in and they've lost 5 or 10%, that's still cause for concern. When a dog comes in and loses 50% of its body weight, that's a real worry. He is showing a lot of the classic symptoms of diabetes. Now, it could be a whole bunch of other things as well, and none of them are very nice, but diabetes you can kind of relate almost to a car that's leaking petrol. If you put a hole in the petrol tank, that energy seeps away and eventually the car stops. Okay. We're in a position now where Bam Bam is close to stopping, and we need to make sure that we provide him with everything he needs to stay around, don't we, mate? Hey? Yeah. Particularly when your poor mummy's on holiday. Yeah. So what we need to do is to immediately have him in hospital, run a few tests, and see exactly how unwell he is. Okay. If it is diabetes, we need to start treating straight away, and that will be with injections. So of course, he'll have to stay here at the clinic. If Natasha and Josiah hadn't brought Bam Bam in today, I really would have worried that he wouldn't have made the night. This is a very thin, very sick dog, and he definitely needs our help. Well, look, you guys just say a quick goodbye, and then I'm going to take him down to the hospital, all right?
Bye, Bam Bam. It was definitely hard to say goodbye to Bam Bam today. Taking him away like this, it just felt heartbreaking, you know, so, but I know that he's in the best of hands. I'm just glad that we got him here on time.
Try it again. Nice. Oh, nicely done. Yeah, she's got it, she's got it.
Nearby in Twickenham, a young family has taken in a very sick parakeet.
Oh, she's dropped it again.
Dawn is one of Scott's 4 sisters-in-law, and her children Henry and Olive are animal crazy.
You remember what she was like yesterday? She was in a bad way. We were in the park with the kids and one of Scott's neighbours comes over to us and says, oh, you're Scott's sister-in-law, you know, do you know anything about birds? Can you come over and help? And I thought, yeah, my sister married a vet, of course I can help you with a bird. Anyway, went over to have a look and yeah, sure enough, this bird was in a pretty bad way.
Around her eye, I can kind of see a very, very thin circle of blue, like our eyes.
Oh, wow.
Do you think maybe she's just made it that colour because she wants to be in our family or something?
I think the kids are probably pretty keen to keep the bird. That's why my house is full of animals, because they keep rescuing stuff. My nickname for my house is now the Ark. They don't come in 2 by 2, they sometimes come in 3s or 4s as well.
I think he's going to be okay.
I don't know, mate. Scotty's on his way. Very much looking forward to Scotty coming over today to just explain a bit about what might have happened to the bird, what we can expect from the future, and what the best thing to do is. You know, it's a wild animal we've found. What are we supposed to do next, really?
Come on, Daddy. Hang in there.
Hey, Sam.
Hi.
Right now, Uncle Scott and vet nurse Sam are busy trying to find out what's caused Bam Bam's massive weight loss.
I'm concerned about a number of possible conditions, diabetes being at the top of the list. So let's take some bloods and see what we can find,
See what's wrong with you.
Diabetes is a condition where animals just can't produce enough insulin, the hormone responsible for converting sugars into stored energy.
It's going to be brave, aren't you?
He hasn't got the energy to fight, I'm afraid. Bam Bam is like a car leaking petrol. Because of his diabetes, he's losing a hell of a lot of energy, of glucose, and he's urinating it out. But unlike a car, when it stops, when it's run out of petrol, Bam Bam will keep going. He'll start breaking down fats, and that will lead to toxic products, which will then accumulate in his body, and if left, he'll die.
Good boy.
Okay, good boy, Bam Bam. Well done, well done. All All right, I'll give our fellow a cuddle.
good.
Do you mind running that for
Yeah,
me,
of course.
please? Diabetes sounds like it should be something very manageable and very treatable, and very often it is, but it can get to an exceptionally severe stage, and certainly Bam Bam is showing all the signs that he is at that stage. You just need lots of love and cuddles, don't you? A lot of faith as well, because you are not well at all. What's your mummy gonna say, hey? She's gonna be very worried about you.
As the results come through, Scott's fears are confirmed.
Bam Bam's results really aren't good. It's clear that he is a diabetic. His blood glucose level is through the roof, and at the same time, he's got a lot of other changes suggestive of an exceptionally unwell dog. The next step for Bam Bam is that we'll need to hospitalise him and place him on a drip. That will help to hydrate him and also to correct some of the changes that I can see on the bloods. Well done. All right, Sam, if you want to pop him in a little candle for me, that'd be great.
And get lots of love and cuddles.
Bam Bam's chances of survival at the moment, I just can't tell you. He is very, very unwell. He's very, very thin and dull and weak. He's not eating, he's not drinking, he's dehydrated. So I just don't know what's going to happen with him.
Bye, Bam Bam. You've got to get better. Good boy. Stay there. Good boy. I'll see you soon.
Hey! Hi, Henry. What have you guys got in there for me?
A bird!
No way, let's have a look.
Scott's now answering an SOS call, and this time it's family business.
Donnie, how are you?
You too, mate, you're right. Good to see you.
And you.
There's another animal in my house.
Yes, and it's not looking particularly well. Can we take this off and have a look?
Yeah, should we do that?
Wow.
I have to say, she's 100% better than she was yesterday. Really not looking very good yesterday at all.
Yeah.
His sister-in-law, Dawn, and her kids, Henry and Olive, are concerned about their new houseguest.
She was basically staying still a lot yesterday, but today she's sort of a bit frantic and nervous.
Okay. Tell me how you found the bird yesterday.
She was on the ground, right at the tree, just staring at it. I just primed the kids to the fact that she was probably not going to pull round, but this is amazing.
She isn't drinking, she isn't eating. She's basically just refusing to do anything.
Looking at the bird for the first time, it's definitely sustained a shock. It looks like it's some kind of head trauma as a result of flying into a tree. It's definitely a little brighter than it was yesterday, according to Dawnie, but this is not a well bird.
Apart from trying to assess the parakeet, Scott's also grappling with another complication.
It's a controversial issue what to do with the Indian ringneck parakeet because it has been around for a number of years, but it definitely isn't native. It's thought that maybe it was just a few birds that were released by accident and there's now thousands in the skies. It's a little bit of a worry though because they're quite a bully of a bird and they're actually pushing a lot of native species out of their nesting sites. So morally, should I even be allowed to release it? And that I don't know. This bird clearly has been through shock, and shock is actually exceptionally dangerous in birds. And even up to 24 hours after a serious injury, they can literally just drop dead. I've actually even had a budgie that I was clipping nails die in my hand.
Right.
They're that responsive to shock. So it's great that it's lasted this long, and 24 hours later it's moving around a little bit more, which is all positive. But, you know, kids, I can't promise what's going to happen here. So I think what I'm going to do, if it's okay with you, is I'm going to take the little birdie to the clinic.
Okay.
And I'm going to have a little look and just see what's going on and see how much damage has been done and if this birdie can go back to the wild. Whenever you are looking after kids, you know that they are going to bond with animals very quickly. And of course, Olive and Henry, straight away, they find the bird, they love the bird. So I'm going to do my damnedest to make sure that this bird pulls through.
Guys, we just have to remember Scotty knows best, okay, with this, so whatever he says we need to do, that's what needs to happen, okay?
All right then, see you later, kids. See you, Donnie.
Bye. Yeah, take it
care.
easy. Thanks, Scott.
All right.
All right.
Bye, guys.
Bye, honey.
See
Take
ya.
care.
See you later.
See you later, mate. It will be quite hard on the kids if the parrot doesn't come back. At the same time, you know, I think they knew they were doing the right thing. They just wanted to bring it
back from the brink.
Off to the vet practice.
Here she comes.
You feeling excited?
Oh, I just can't believe it's actually happening.
Meanwhile, Scott's head vet nurse Emma and her partner Steve are at the Kingston Riding Centre, waiting for a very special delivery.
She really has come a long way. I'm excited, I'm nervous, I'm probably going to cry.
3 years ago, Emma reluctantly left behind Vava Voom, also known as V, in her hometown in Portugal.
Hi! Hi, Bubs!
Scott had convinced his right-hand nurse to follow him from Portugal to London to set up his first practice in Richmond.
I think he offered me the job 4 times before I actually accepted it, and it has turned out to be the best thing that I've ever done. He is the big brother that I don't have.
Hello!
Bringing V out to London was definitely a huge decision, but the final piece of the puzzle of my life moving to London.
Hello, my darling. Hello.
When the door opened and you see her there, happy, ears forward, looking at me, it's a proud moment, it's a happy moment, and it's very, very emotional. I don't think I could pick one word to describe it.
Come on, Bubs.
It's the feeling of having something taken away from you that's suddenly given back, something very special. How they become such a big part of your life, of your family, of your heart.
You happy?
Just a little bit.
Emma's been quite nervous, to say the least, but, you know, the more she thought about it, the more excited she got, and closer to the day, it was, I don't even think she slept that well last night because she was so excited.
Hello. Hi, Bubs.
She's gorgeous.
How are you feeling?
She's my best friend and she's my child all at the same time, so it's very special. She helps me. I love how she makes me better. I love how she makes me enjoy life a little bit more.
Yeah.
Let's have a look. See if you got me my best light. Oh, I love that! This is going framed. I definitely just look forward now to being able to get a few hours in my day and just be able to go and ride. I think Steve will be definitely left at home watching the football while I spend my weekends up here with my other love.
Her other love. It's good compromise.
What's going on? Who's there?
Look, he's a bit handsome.
Hey, Nath.
Hey, where you got that?
Oh, I've been picking up birds again. This time, my sister-in-law, Dawny, has found a rather unwell ring-necked parakeet. Today is all about having a look and seeing what's wrong with it. So let's bring you through the consult room and have a little look, shall we? So this bird has sustained some kind of trauma, some kind of injury. I don't know what it is yet, so I do need to do a full, thorough clinical exam. Let's have a look at you, shall we? Hey. Right, start with the head, have a little look around there, have a look at the eyes, have a look at the beak, is there any discharge? Then I go and have a look at the wings and see are they healthy? And also to see if the bird has any condition, I press on its breast muscles, which would suggest the bird's been eating recently. And then finally go down to the back end and just see is there any diarrhea? Is the bird at all unwell? You look like a pretty healthy little bird, really, don't you? You're really surprisingly friendly for a wild bird. Yes, you are. You're acting weird, aren't you? Hey? This bird is showing some really weird behaviours. The fact that she's not particularly frightened of me, nor is she trying to fly away, that is strange for a wild bird. So I do need to do a further few checks just to find out exactly what's going on. Okay, that might be a problem. You can't see, can you? Let's just try something here, shall we? So, little birdie, what I should be seeing is your pupils constricting or getting smaller, but it's pretty obvious that you can't see that light at all. You really can't see anything. You're not responding to me doing this, and you're not responding to light. This is a healthy bird that has all of a sudden lost her vision, and I would suggest that's because she's simply flown into a tree, hit her head in the place that controls vision, and sadly now she's blind, and I don't know when her blindness will resolve, if ever. Because you're a non-native invasive species, I can't let you go anyway. But now, being blind, I've got no choice. So what we're going to do is we're going to clip your wings so you don't injure yourself. You don't need any more visits to the vet, do you? And then we need to try and encourage you to eat. Nathan, can I get you, give us a hand with the bird, please, mate? This little bird's blind, and as a result, if she can fly, she can injure herself. And so if I clip her wings, she won't be able to get the lift that she needs to fly and will be much more safe. There's no nerves going down the feathers, so it's a bit like cutting hair. As long as it's done carefully, it's very safe and non-painful.
The parakeet will now need to stay in the clinic for observation for at least another 24 hours.
So now that you clipped her wings, what are you going to do with her now?
We need to find you a home, don't we? I know a couple of kids that I might be able to twist their arm and see if they'll take on a new birdie. Hey, mummy might not be so pleased, but hey, it's all right. Hey, another angry sister-in-law. Yeah, I've got so many as it is. Ooh, you're liking that, aren't you? Here we go. I'm so happy with this guy. He is doing so much better, isn't he?
He's perked up so much. He's
I know.
so lively.
2 days later, and Bam Bam is definitely on the road to recovery.
Hey, well, let's see. You're going to eat some food because that is the key to starting to control your diabetes, isn't it?
When his babysitters Natasha and Josiah brought him in, the Maltese Terrier had lost a life-threatening amount of weight.
There you go. You're just a skin and bone.
Scott discovered Bam Bam was suffering from a severe case of diabetes.
You are not well at all.
With his owner overseas, the terrier was admitted to the practice for 24-hour care.
Yeah, you're getting better. Better and better. Good boy. Bam Bam is so thin, painfully thin, and we need to get some weight on this guy. The only way to do that, of course, is when he starts eating, and of course then starting the insulin injections, which will help him store that energy as fat. Okay, good boy. Good boy, that's it. Wow. God, the difference in the last few days is just massive, isn't it?
He's suddenly come back to life.
I know, he really has. What a good boy. There you go. Hey, so we can start giving you some insulin now, can't we? You lost so much weight, didn't you? You're already starting to put some weight on, which is great, but still a long way to go. Those insulin injections will help you do that, though, won't they? Yes, they will. But we're going to need to give them every 12 hours. So that means that he can't be left. So I know where I can take him where not only he can get lots of love and affection, but also 12-hourly insulin injections. Oh, that's nice, isn't it? Yeah. Because Bam Bam has improved, now I can start giving him more regular insulin injections. And when the injections are given, sometimes they can go to hyperglycemia or low blood sugar. They can go into coma and even die. So he needs to be monitored very, very closely. And I think that's best done at my place. Okay, mate. Let's get you comfortable. Good boy. Okay, mate, you ready for this? Hey? You wanted attention.
Scott's on his way home with Bam Bam. The terrier now needs 12-hourly insulin injections after just being diagnosed with diabetes.
Family, look what I've got. Look.
Bam Bam's owner Alyssa is heading back to Richmond from her overseas trip.
Whenever we have patients long-term in the practice, the one thing that I do notice is that they really look for love and affection. And the great thing about bringing them home is they get bucket loads.
Of
course you can. Well, first of all, it's a little boy.
Oh no! That's really gorgeous. What's his name?
His name is Bam Bam.
JJ, look.
Bam Bam actually seemed really chilled out with the kids. He just loved the cuddles, loved the snuggles, loved all the attention. He seemed to be a very happy boy. All right, mate, it's blood and injection time now, isn't it?
Do I get to have a snuggle
Absolutely.
now? Not you, the dog. Oh, hello, little man. Hello. Oh, you are just delicious. You are just delicious. You're so cute. Okay, no, so
Right.
I'm going back to training from
Back
the old
to your
days.
nurse training days, yeah.
Back to the old days. Come on, Bam Bam. I can remember this. I can remember this.
I'm very lucky to have a wife who doubles as a vet nurse from time to time. So whenever I bring patients home, she's always there, ready to lend a hand, unless they're cats. She's not great with cats.
So what are you testing for here?
Just testing for blood glucose. Just
Okay.
holding that on for me there, my love. Thank you. Yeah, just to see what his sugar levels are right now, just before we give his insulin.
It was a very short vet nursing career, 18 months, and I was good with the dogs. I think Scott would say I was good with the dogs, but cats, I was just rubbish with cats. That's 8.2, so what's that out of?
The normal range is between 5 and 8. He's been up to 30
Oh, wow.
whilst we've been looking after him. Okay. All right then, champ, you're
Snuggle
gonna be
bum.
brave. Oh, well done. Good boy.
Brave.
Brave boy.
Brave puppy. He's very thin still though, hey?
He is. He's got a long road ahead of him, this guy. Haven't you, hey?
It was like the team back together today. Me holding the little fluffy doggy, Scott doing his bit. It was nice to just kind of go, oh yeah, I know how to do this. I can help you out with this one.
Okay, who's gonna help me bath him?
Oh,
Okay, so put your hand out. There we go. Let's put a little bit of shampoo on there. That's it. There you go. And then just give him a little bath. That's it, nice and gentle. So we decided that Bam Bam looked like he needed a bit of a spruce up. So we thought, what nicer thing to do than give him a little bath in the kitchen sink. Okay, and it'll be nice and gentle. Remember, he's a really little doggy.
You've got his head all fluffy and princess.
He's such a nice boy, isn't he, Summer?
He's adorable. Bam Bam, he needs you so nice and clean.
Yeah.
After your bath, Bam Bam, you're gonna go to bed.
For me, life isn't complete unless animals are in it. And as much as we absolutely adore our kids, to have the animals alongside and to see how much the kids love them, for me is the perfect form of family life. There you go. Oh, good drying, Quinn. All right, let's all go off to bed, shall we? Come on. There we go.
Bam Bam.
Come on, Bam Bam.
Yeah, horsey. Yeah.
I do really need to get back to the clinic now, but I know that Bam Bam's in really safe hands here at the house. All the injections have been given, and you never know, the little guy, if he plays his cards right, he might even get a lullaby as well.
So you better stay warm with Teddy as he tucks you to bed.
The kids are completely in love with him, and Scott's going to know he's got a job on his hands to take this dog away. But there is an owner somewhere who's going to want him back.
Night night, Bam Bam.
But just as Scott is heading back to work, there's an urgent call from Maz, the practice manager.
Hello?
Hey, Scott, it's Maz. Listen, we need you to get back to the clinic as soon as possible, okay? We've got an emergency that's come in. Charlie's been brought in. He's collapsed and barely conscious. Steph and Emma are doing everything they can to keep him stable until you get back, but I really need you here as soon as possible.
Okay, no worries. I'll be there as soon as I can.
Okay, great. Thanks.
Okay, bye. Gee, that doesn't sound good.
Head vet nurse Emma and locum vet Steph are at the clinic trying to stabilise a critical patient, 6-year-old Wheaton Terrier Charlie.
So this morning we get a call about Charlie to say that he's off his back legs. So I was expecting to just find Charlie a little bit stiff and not able to get up. What I found was a completely different story.
Charlie's a fantastic dog. He's been coming to my practice for a number of years now, and we're all really fond of him. But he's been really unwell of late, and if he's gone into the practice for an emergency, you know it's going to be bad.
When Charlie arrived into the practice, when we finally got him back, he was barely breathing. He was semi-conscious, but he was also in a lot of pain. So Steph and I started Charlie's immediate care along with the other nurses. But as Charlie is one of Scott's long-standing patients, we know that we just need to get him back in the building as soon as possible.
Oh,
Hey, Maz. How is he?
Hanging in there, but barely.
Okay. Right, guys, what have we got?
Hi, Scott.
Oh, yeah.
Okay, so we've got Charlie here.
Just like Bam Bam, Charlie's family is also away on holiday. The grandparents called the practice to say the Wheaten Terrier had collapsed.
We went to the house to go and see what the situation was.
He seems quite painful even now.
Yeah.
We've given him something for pain.
So we've given him some pain relief. We assessed the situation, got him over here because he was collapsed. He was really in a bad way.
Dead on the scene when we saw
Really?
him this morning.
Okay. Charlie has a condition called immune-mediated thrombocytopenia. It's basically where his own body is attacking platelets, and those are the cells important for clotting blood. Right now, his platelet count is at an all-time low. He's bleeding everywhere, and he's in real trouble. We're unsure as to exactly what has caused the body to behave that way, but we have a feeling that he may have a condition called leishmania. Leishmania is a very nasty disease spread by sandflies, particularly in southern Europe. Charlie went on a holiday recently. He must have been bitten when he was away on holiday. He's come back, and this condition is manifested in lots and lots of different ways. His kidneys are affected, his skin's affected, his joints are affected. He is a very, very unwell dog right now. Well, I can see straight away that his gums are exceptionally pale.
And the petechial hemorrhaging.
You can see he's got some hemorrhages. So we've done some initial blood work. The blood work shows that he is severely anemic, and he is actually going to need a blood transfusion.
Okay. His platelet count is, there aren't any. As you know, lowest it should be is about 35%. His is at 15.
Right, so it's no surprise he's bleeding from everywhere,
He's bleeding from everywhere, and
time is of the
essence. That's right.
Okay, so I think what the big thing is now is about the blood transfusion. So in this instance, of course, we would normally do blood typing to be able to determine if there'd be any reaction. We just don't have time here. So we need quite a bit of blood for Charlie, so as a result, we need quite a large dog to provide it. The only person I can think of that's got a dog of any half-decent size is Nathan.
Yes.
So let's give him a yell
Maisie.
and pull in Maisie and see if she can donate some blood for little Charlie here. So the main medical issue that Charlie is suffering with is anemia. So he has a low red blood cell count. He's very pale, he's struggling to breathe. So what we're trying to do is to supplement the red blood cells by giving him a blood transfusion.
Hello? Hey Nath, it's Maz. Charlie's been rushed in this morning and he's in a really bad way and we need to do a blood transfusion urgently. Is there any way you'd be able to bring Maisie in?
Sure, not a problem. I'll be on my way now.
Amazing, thank you.
It only takes 10 minutes for Nathan to arrive with Maisie.
Yeah, all right, you can be a good girl. I know she's just a young girl. Do you reckon she'll stay still for this, or?
I don't know. I'm gonna have to think it's a little of a struggle, but we'll go.
So a bit of sedation is probably the way to go.
Yeah, I think so.
Okay, hello, baby. It's great that Nathan has allowed us to take the blood from Maisie. She's a big dog, so she can give us the volume that we need, and it's just so important for Charlie that he gets this blood transfusion. It's really the only chance that he's got for survival. Something like that. Hey, yes, I think so.
Okay, come on, calm down.
So calm down, Maisie, come on.
Poor Maisie, she's still really young. She doesn't know what's going on.
You gonna let me do it? Oh, Maisie.
It's so hard to see your dog so stressed, but you know it's for a good cause, and if it can help save Charlie, then it needs to be done.
This is coming out very fast, nicely actually. She's obviously got good blood pressure. Nice, big, healthy young dog. Mate, you're a generous soul for doing this, or should I say Maisie's a generous soul for doing this. She might save a life doing this.
She's done all the hard work, hey?
Charlie has touched the hearts of everyone here at the practice. He is such a beautiful, sweet-natured dog who's really been through hell and back with all the conditions that he's suffered of late. Charlie's owners are some of the best. You know, they really are great people. And like anyone, they deserve a holiday. But right now, they're thousands of miles away trying to make a decision about their dog that they love, who's in our clinic right now fighting for his life. And I'm sure their hearts are breaking. All right, sweetheart.
Scott, Charlie's crashing. I need you now.
Okay, yeah.
At the Richmond Practice, Scott's desperately trying to save 6-year-old Charlie. The Wheaten Terrier collapsed earlier today.
Her chest is starting to fill with fluid. She's filling with fluid. I mean, she's bleeding out. She's really not looking good.
His family is on holiday overseas.
Yeah. Get the crash box. Charlie's condition means that he has absolutely no platelets, so that means he can't clot blood. He is bleeding from absolutely everywhere. He's in real grave danger, and we need to give him this blood transfusion now.
So we just got to go with it. Anything is better than nothing, surely.
Okay.
It's in, okay.
It only takes a few minutes for the transfusion to take effect.
There's definite improvement in that colour, there's no doubt about that. Charlie was starting to deteriorate quite rapidly. His breathing was getting more and more laboured and his colour was getting worse and worse, paler and paler. So thankfully, we've managed to get the blood transfusion into him just in time and he is responding.
It's just a waiting game now, isn't it, I guess? It's going to do its job, I hope.
Yeah, well, yeah. We just have to give it some time and see if he manages to survive long enough for his red blood cell count to be replenished. But who knows how long.
If we can get that up, we may have a chance.
We've literally done everything we can do for Charlie now. There's nothing left. All we can do is hope that he makes it through the night. I just have no clue as to where this is going to go.
I know.
The next morning, Emma is on her way to work early. After yesterday's emergency, Scott finally ordered her to go home to get some rest. Now, she has only one question on her mind.
Hey!
Morning.
How is the boy?
He didn't make it.
Oh, you're kidding.
No. Yeah. The news for Charlie isn't good. Sadly, he passed during the night. He battled hard and you know, everyone just worked so hard with him, but he was just so unwell, desperately unwell.
Oh, Charlie.
And yeah, he slipped away in the night. So, yeah.
I'm absolutely heartbroken to hear that Charlie's passed away. Yeah, I don't have many words at the minute. It really, really sucks.
Yeah.
And you do so much and you try so hard. He's left a hole behind. And it's, yeah, it's gonna take us a while to get over his passing, because he was a special boy and we're all gonna miss him.
Done our absolute best. Yeah. I know.
Sucks.
It's very hard to break the news to Emma that Charlie had passed. She'd put in such an amazing Herculean effort to keep him going until I got into the practice and was there by his side constantly. She's devastated that he's passed on. Well done. Well done.
He was a brave boy until the end, as he was with everything that life threw at him, but he tried his best and he fought hard. And I just hope now he's in a better place.
Hello. Hey guys, how you doing?
Yeah.
Oh, thank you.
Thank you.
Bit of a rough day.
Yeah.
Just sucks, you know?
It can't just be your veterinary knowledge that makes you do this job. It can't be. You've got to have a level of compassion. You've got to feel it right in here. And poor Charlie. He's had a lot going on and a lot going wrong, sadly, but he flipping fought, you know. He went as long as he could.
He really did.
He did everything he could. He just got a bit tired.
Yeah.
They're your friends. They've become your friends. You get to know the cats, you get to know the dogs, you get to know the rabbits, you know. You get to know them all. And then when it doesn't end how you want it to end, it crushes him, of course it does. He's only human at the end of the day, you know what I mean? He's a pretty decent human, but he is only human, you know, and he's got a heart as big as anything.
Cup of tea to Charlie.
Yeah.
To Charlie.
Thanks, Mass. It's always really hard to lose a patient, particularly one that's a firm favourite of the practice like Charlie. But you know what? The job still needs to be done, so you've got to pick yourself up, dust yourself off, and get on with the job. Right, you, on best behaviour. I still need to find a home for a blind parrot, and I certainly know the first place that I'm going to try. Here we go. Hi guys!
Hey!
Look who I've got!
You got that birdie. Hello, darling.
Good girl.
Trying to eat Scotty.
Now remember, she's a bit wild, so that's why she's having a bit of a nibble of Scotty's fingers. So the interesting thing, guys, is that your bird's actually blind. So she can see. She can't see, I'm afraid, no. She can definitely hear me. You watch.
She's like, how dare you say that?
I thought maybe I was being a bit cheeky and bird, was I? But you can see that she can hear me, which is great. So she hasn't lost all of her senses, but she can't see. I think it was quite sobering for the family to hear that the bird is blind. But it's amazing the amount of pets that we treat that are blind and their families deal with them very well. It's about making sure that their environment doesn't change very much and just understanding the sensibilities of a bird that can't see. Unfortunately, because she's blind, she can't go back to the wild. And also because she really shouldn't be flying around with all of our very important British species, she also can't go back to the wild. So, so kids, would you like a bird?
Yeah?
Yeah, I think so. What a great idea. Let's keep a bird. Look how excited Mummy is about it.
I'm so excited.
Yeah, I
can see.
That's brilliant. Can we have a chat?
Hanging out with Dawny and the kids has really put a ray of sunshine into a fairly dark day. What do you think? And even though I've totally railroaded my sister-in-law, Dawny, into taking the parrot, I know that this is the right home for this gorgeous little bird with very special needs. So what kind of name do you think we could come up with this little girl?
Kia. Kia, yeah.
Kia. Where did you get that name from?
It's a cartoon called Just in Time.
Okay. A cute little name, and I always think if you name a pet, you've got to keep it. So it looks like their family's increased by one feathered friend.
Hey, Scotty, I have a question.
Oh, yes.
How long is Kia going to live?
30 years or so.
Yeah, cool.
Thanks, Scott. I mean that. Thanks. You know.
I can tell.
Thanks.
Yeah,
Thanks.
yeah.
So where is she going to live? That's a really good question. Probably the same question I had to ask myself with the battery hens, the dog, the 2 cats, and any other of the crazy animals that come passing by my house that have needed somewhere to live. I suspect here, that's where she's gonna live, and I've got another animal in my house. And I should just rename my house the Ark, yes.
She's a happy, healthy girl. She just can't see. She can't see how utterly happy you are.
I see she's made a few marks on your fingers from her claw. We really, really love her. No, we really, 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 really love her. Actually, no, we really, 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 really love her.
That's it. Look how she's listening to you. Yeah? That's good. Kia's a very lucky bird. The kids are in love with her, and yes, she's a blind bird, but I think given the right care, she's going to be a very happy bird, and seemingly also a happy family.
Come on, Trouble. Way, there we go. Good girl.
For Emma, the best therapy is the newly arrived V.
Good girl.
A quiet walk through Richmond Park is helping her come to grips with the loss of Charlie.
She's my outlet. She doesn't talk back, she's a good listener, so you can get rid of any frustration, and it's therapeutic. The bond that we have is something quite special, so to have her as my support system is magic.
Good girl.
Hello, mates. Oh, you're looking perky today, aren't you? Hey, you want to go home and see Mummy? Let's hope we can make that happen, shall we? Come
And finally, Bam Bam's diabetes is under control.
Bam Bam is doing fantastically well. He's putting on weight every single day. He's eating and drinking really well, and his bloods are looking beautiful. So he's very much in the right position to go home. Now it's owner Alyssa's job to take on all the hard work.
What a clever lad. What a clever boy. You ready to go home?
I know that Alyssa has been dreadfully concerned about Bam Bam while she's been away. Now she's back, I'm sure she just cannot wait to get her hands on him. Look who's this. Hey, Alyssa, how are you?
Oh, how are you?
Who's that?
Oh, miss you so much. How are you? Hi, Bam Bam.
Who's that? Is that Mummy? Oh, he's been dying to see you.
Oh, me too. Miss him so much. Bam Bam.
Well, look, I've got lots to tell you about, so let's pop into the consult room. We'll go through everything.
Thank you.
Have you ever had to give injections to a pet before?
No, never. This is gonna be first time.
How are you feeling about that?
Nervous. I hope I did it. I can do it.
Bam Bam now requires twice daily insulin shots to combat his diabetes. It's a big ask for Alyssa.
So you can suck that up using that syringe for me. Perfect. Pop it through the skin. You'll feel an actual pop.
Oh, it's gonna be hard.
You can do it.
I'm so nervous.
Be brave. That's it. Well done. That's it. Good
And
job.
then?
So you suck it back a little bit and then inject. Good boy. It's all right. It's all right. There, that's done. I know. That's it. Good job. Well done. Well done. Well done you as well. It's hard to do. It's really hard to do.
So nervous.
I know. But you'll get better and better at it, and he'll get better and better at taking it. All right? Good boy, Bam Bam. Hey, Mommy's so good. It's really tough as an owner to give an injection to your pet if you've never given one before, because it is inflicting a very small amount of pain. But what Alyssa's got to remember is that Bam Bam's life depends on those injections, and she's just got to make it happen. All the best.
Thank you.
My pleasure. Bye. Bye, Bam Bam. See you, mates. Bye-bye. See ya.
Let's go home with Mommy Bam Bam.